Dr. Clark, Dr. Chang, Mr. Montague, Mr. Shaw, Mr. Samuda, Ms. Grange, Mrs. Williams, Mrs. Malahoo Fort, Dr. Tufton, Mr. McKenzie, Mr. Chuck, Mr. Vaz, Mr. Warmington, Mr. Hutchinson, Mr. Child, Mr. Green, Mr. Terrelong, Ms. Smith, Mr. Main, Dr. Dunn, Mrs. Cuthbert Flynn, Mr. Morgan, Mr. Davis, Mr. Brown, Dr. Brown-Burke, Dr. Charles, Mr. Chin, Mr. Clark, Mr. Cousins, Ms. Crawford, Ms. Daly, Ms. Davis, Mr. Golding, Mr. Graham, Dr. Guy, Ms. Hamilton, Ms. Hannah, Mr. Henriquez, Mr. Henry, Mr. Hilton, Mr. Jackson, Mr. Lawrence, Ms. Lee, Mr. Miller, Ms. Morrison, Ms. Nita, Mr. Paulwell, Mr. Phillips, Dr. Phillips, Mr. Robertson, Mr. Robinson, Mr. Sibbles, Mr. Slowly, Mrs. Vaz, Dr. Wheatley, Mr. Williams, Mr. Wilson, Mr. Witter, Mr. Wright.
Thank you, members. Before we begin our sitting this afternoon, I would like to use this opportunity to introduce to all the members of Parliament our new legal counsel that has joined the Parliamentary. She is Shanae Cunningham, the lovely lady you see to my right, and she joins us with a wealth of experience. I understand she's dedicated to whatever she does, and I gather she's a patient and gentle person, which is a necessary requirement to working with all of us here in this house. So we want to welcome her to Parliament and to trust that in all ways her stay will be fruitful, prosperous, and so she will remain with us as long as many parliamentarians have served in this house. I want to welcome you and trust that your tour of duty will be worth the while. With statements by ministers, and we're going to start with the Deputy Prime Minister and the Minister for National Security. Oh, I beg your pardon.
Yeah, Madam
Please
Speaker,
forgive me.
Madam Speaker, thank you very much for your kind indulgence, and I'd like to join you in welcoming our new legal counsel and to speak to the fact that we have been trying to develop the capacity of the House to respond more to the needs of members in terms of building our own abilities to do better oversight work. And I think that this is part of a process that you're going to see escalated during this term, because we are quite determined to enable the committees of the House in particular, the sessional committees, to be far more equipped with prompting information and appropriate notes, so that the extent of the investigation and the quality of the investigations that are done by the committees are at the highest level. You know, I think people mustn't look to the committee for salivating news. People must look to the committee always for constructive critique and also for guidance, because that's what the committees are about. The committees are supposed to, by and large, oversight the performance of agencies, MDAs, and to give support to policies and outcomes of policy. And if in the process we discover whatever we discover, by all means, there's full transparency, and we are committed to ensure that the appropriations as approved and passed by this House are effectively, transparently, and properly administered and spent. So we want to again welcome you, Shanique, and to say that you have the full support of the members here, as we will be drawing on you and the wisdom and knowledge that you will bring to bear to your job. Madam Speaker, there will be 4 statements by ministers today, and they will come in this order, so it may please you not necessarily to call each one, but they will follow in the order that I indicate. The first statement will be made by the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, and it will be followed by the Deputy Prime Minister, the Honorable Dr. Horace Chang, and then the Honorable Audley, the Minister of Investment, Commerce, and Industry, and then finally the Honorable Clifford Everald, Warmington, Minister without portfolio in the Ministry of Economic Growth and Job Creation. And that will be the flow, Madam. Please you.
Thank you, House Leader. Dr. Chang. Oh, we're starting with Dr. Tufton. Thank you. Thank you.
Thank you very much, Madam Speaker. Madam Speaker,
do we have copies of your presentation, Dr. Tufton?
They were given, Madam Speaker.
Please make sure the opposition has. Yeah.
Madam Speaker, in keeping with the Ministry of Health and Wellness's commitment to keep this Honourable House and the people of Jamaica informed of the latest developments on COVID-19, particularly on the availability of vaccines, I rise to share the latest information on the deployment of COVID-19 vaccines in the country. We have been advised, Madam Speaker, last evening, by the COVAX facility that the country is set to receive between 146,400 and possibly up to 249,600 doses of the AstraZeneca vaccine by the middle of February 2021. That's this month. This means that some 125,000 Jamaicans, or up to 125,000 Jamaicans, could receive vaccines during the months or the latter part of February into March. This is 2021. The process, therefore, Madam Speaker, assuming that this commitment is delivered on, is therefore in progress to vaccinate our population. Among those to receive the vaccines are, in the first instance, are our frontline workers, including our nurses and doctors, and then to our vulnerable persons. Chief among those are persons 60 years and older. Madam Speaker, the availability of this vaccine is, of course, subject to the World Health Organization's emergency use listing, and the indicative amount is based on the current communication from the manufacturers, which is a part of the COVAX arrangement, in this instance, Serum Institute of India and SK Biosciences. Madam Speaker, if additional supplies under the COVAX arrangements are received, and you will recall that I did update the Honourable House as to the commitment for 16% during the course of 2021, approximately 450,000 Jamaicans by the end of the year under this arrangement would receive vaccination. I must hasten, however, to caution that it is likely that the allocation could be adjusted. It could be adjusted upwards or downwards, depending on the present global circumstances and any anticipated challenges that this facility may encounter, which most likely would be issues around manufacturing. But to date, so far, so good. The commitments have remained true, and this latest correspondence that we received only yesterday is an indication of confidence in the process to deliver on the commitments that we have signed on to. Madam Speaker, there are several steps that we must action as Jamaica prepares to receive its first shipment of COVID-19 vaccines. Among them, having the necessary indemnity and liability frameworks in place in order to complete the agreement directly with AstraZeneca, as well as finalizing other procurement matters with the COVAX facilities management. Madam Speaker, again, our commitment has been to explore other options. It was raised, I think, by the opposition leader a few sittings ago that the 16% would certainly give us some protection, but not give us the level of protection, the herd immunity that we seek. And I just want to reassure him and the country that we are pursuing other options to support or complement what the commitments under COVAX. We have begun work in collaboration with the Ministry of Foreign Affairs and Foreign Trade to this effect. We have been in discussion, Madam Speaker, colleagues, with 5 countries and 1 additional facility, all of which are at an advanced stage of vaccine development. So, Madam Speaker, Jamaica has made a formal request to the CARICOM Secretariat for some 250,000 doses of vaccines as determined by the Caribbean Public Health Agency, CARPHA, from the 1.5 million doses allocated to CARICOM by the African Medical Supplies Platform, AMSP. This is part of the ACP countries, which we, through CARICOM, had negotiated a possible allocation, and the commitment is for a 1.5 million dose delivery, where Jamaica would benefit from some 250,000 doses. And those discussions, Madam Speaker, colleagues, seems very encouraging. That would be in addition to the 16% being committed under COVAX. Our late interest in the AstraZeneca vaccine from this facility, Madam Speaker, would be, the AstraZeneca vaccine would be the vaccine under this arrangement. India also has Covaxin vaccines available, and it will be making some 500,000 doses available to CARICOM. So that, again, is another additional amount from which Jamaica will benefit. We are, however, awaiting the approval of the WHO of the Covaxin and the notification of the amount that will be allocated from India for Jamaica. Madam Speaker, we have also indicated our interest in obtaining information on vaccines from China and Cuba. Both countries have engaged us in conversation, or we have engaged them, and they are both going through clinical trials for the development of vaccines and are at a relatively advanced stage as far as stage 3 trials. And I did explain what the trials represented that is contained in the vaccine plan for those who want to reference how far that is. We await further information on those vaccines as it relates to their officially assessed level of clinical efficacy and the allocation that could become available to Jamaica. We have also, Madam Speaker, colleagues, explored the option of obtaining the AstraZeneca vaccine from Mexico and the United Kingdom. The Ministry of Foreign Affairs and Foreign Trade has initiated dialogue with the UK government. I also met with the High Commissioner to Jamaica. Even as we talk with Mexico under our bilateral arrangements, with an option to approaching our negotiation through the intergovernmental machinery, the community of Latin American and Caribbean states. Madam Speaker, our objective in doing all of this, whether COVAX or the additional possibilities, is to explore all the options, to expand the pool of vaccines being made available to Jamaica so that as many Jamaicans as possible can be vaccinated. And this will help to slow the spread of the disease, of course, and reduce the severity of illness for our vulnerable population and the population at large. So there is a lot of work that is taking place beyond the COVAX arrangement. Madam Speaker, vaccination is a key component of our response to combating the COVID-19 pandemic. And in the coming weeks, it is important that we zone in our communications with our various stakeholders, including members of the public. Over the next 3 to 5 days, I will be meeting with the National Vaccine Commission, which is a multi-stakeholder body, which includes private sector, civil society, and others, and the National Coordinating Committee, which is the technical working group comprising of clinicians and other public health specialists. And these meetings will be held to finalize our plans to introduce the first set of vaccines to the country. The Ministry will also convene a meeting, Madam Speaker, with private practitioners from across the island this Sunday, February 7th, and this is a virtual meeting, to discuss their role in the distribution of the vaccines, especially among the high-risk groups. Madam Speaker, we will also intensify our health promotion and communication machinery, beginning with a town hall meeting on Thursday, February 4th, this is this Thursday, to further foster trust of the vaccine, dispel myths and misinformation, provide factual and accurate information about vaccination, and hopefully through this process, gain public input in the vaccination strategies to be deployed. Madam Speaker, it's one thing to have the vaccine, and we are confident that we will get an allocation soon. The other issue, of course, is to overcome the barriers of resistance because of stigma, because of myths, because of lack of understanding or an appreciation for the process. And we understand that we have a role to inform the public and to provide endorsements and support. The clinical team and I will also, Madam Speaker, be available for interviews in the print and electronic media as we all work for acceptance and uptake for the approved COVID-19 vaccine in Jamaica. Madam Speaker, this for us is critical to, again, slowing the spread of the infection, reducing morbidity and mortality, as well as the critical component of rescuing our economy. Madam Speaker, the Ministry is taking all the necessary steps to ensure that safe and effective vaccines are deployed through the continued monitoring of developments related to COVID-19 vaccines. Our commitment remains to safeguard the health and well-being of every Jamaican, even as we continue to implore Jamaicans from all walks of life to play their part in reducing the spread of this disease. Let me state categorically, Madam Speaker, despite the hopes that we place in a vaccine as being the antidote or the most effective response to COVID-19, let me state clearly that COVID-19 is still a clear and present danger to our population, and until we are able to get this herd immunity from our vaccines, we have to continue to be cautious and observe those protocols. So vaccines offer protection, let us remind ourselves, Madam Speaker, only to the persons who take the vaccines. Therefore, every Jamaican must remain vigilant and compliant to the washing of hands or sanitizing frequently, maintaining of the physical distancing of 6 feet from others, avoiding crowded situations, always wearing a mask, and comply with all the measures under the Disaster Risk Management Act. Adherence to the infection prevention and control measures are our only real defense, Madam Speaker, against COVID-19 as we continue to see a gradual increase in cases. And just to remind the country, in the last 5 days, the country added some 538 new cases, with hospitalization on the rise, ranging from 89 to 101 COVID-19 positive patients in hospital in the last 5 days. The number of deaths, unfortunately, have increased by 9, and while some 8 to 11 persons daily are considered to be in a critical condition. And I'm not attempting here to dampen the hopes of all of us that we will have a vaccine by giving the sobering message that COVID is still here, COVID is still a keep, as we would say, and therefore the protocols must be observed until such times as is deemed safe for the public, and the government will continue to provide information. Madam Speaker, so in closing, this is not the time to become complacent. I implore and encourage all of us to protect ourselves. However, at the same time, I want to reassure the public that the government is doing all it can, and we will see vaccines being administered. We still have a lot of work to do. Commendations to those who have done a lot of work to date, to our partners who have been a part of this process, bilateral, multilateral partners. So let us move to the next phase once we get these vaccines. But in the meantime, let's observe those protocols. Thank you, Madam Speaker.
Thank you, Madam Speaker. Madam Speaker, I want to thank the Minister for giving the Parliament and the country the update on the latest development as it relates to the country's receipt of the vaccine from the COVAX facility. It is indeed a welcoming news, and I think, Madam Speaker, it would be even more welcoming had the Minister indicated that we would be getting more than what we would have been getting at the current, at this particular point in time. But as I said, it is indeed welcoming that we are receiving it almost a month and a half earlier than it was originally anticipated to be here. Having said that, however, Madam Speaker, there are some questions that arise. And inasmuch as we are also concerned about the numbers of cases that we have seen 195, I think, yesterday, Minister, in terms of the positive numbers. We also want to endorse the caution that you have indicated to the country for them to be cautious and to take care and to practice the measures that are necessary to prevent the transmission of COVID-19. But as you have indicated by this document that you presented 2 weeks ago, Minister, within it there are some matters arising that jump out at us right away. And one of them relates to the cold storage facility as part of the plan in terms of the logistics of getting it out. The ministry has indicated that they are going to be the procurement of those cold storage facility within the months of January, February, and March. It might be useful, Minister, if you'd give the country an update as to where we are with those, so that getting the vaccines a 6 week earlier than was originally planned, one would want to think that despite the fact that we have a history of vaccine storage in this country, that additional amounts are there so that we'll have storage for those that are usually used as part of the normal immunization program, as well as for this facility. The other part of it, Minister, relates to the timetable for the training of those persons. And I see by your presentation here that you are basically upping the ante in terms of the collaboration and the interface with other areas, private practitioners, as well as others, to try and roll it out. We just want to ensure that this is going to move at a pace which will see that the original timetables are, in terms of implementation, are met without any hiccups in the system. So we speak to the infrastructure and the rollout plan and the timetable. Minister, I know that in entering the COVAX facility, we were advised, and based on your presentation too, essentially what we were doing was hedging a price with PAHO WHO. Now that the AstraZeneca vaccines are coming out at $4 to $5 per dose, and similarly with the one out of the Serum Institute of India, which is the Covaxin around the same price, is there any likelihood, and I'm just asking because I appreciate the fact that a hedge was done, is there any likelihood that we will get more for the $10 plus US we are paying a dose, because it works out to about 40% cheaper now than we had originally anticipated based on what PAHO told us? Is there any likelihood that for that amount that we have invested, the country will get more vaccines from that facility? Minister, your presentation also indicated that, I think it was a PAHO study that was done, indicated that about 35% of the population were willing to accept the vaccine. And as a consequence of that, the rollout plan spoke to a public relations campaign which spoke to behavioral modification and acceptance of the vaccine. Now that we are seeing it, and I'm reminded of today on a particular, very popular radio station, informal survey was done, and only 30% of those who responded say they would take the vaccine. The reality is that this particular program needs to move much faster if the anticipated benefits from the vaccine coming earlier is going to be had. Minister, we see where the numbers that are coming through CARICOM, and I'm happy that CARICOM is getting some from the African Union in terms of contribution. But you will recall that at the last, or the first, for this session, the Joint Select Committee on the COVID-19, we asked the question whether Jamaica has approached CARICOM as a unit outside of getting that contribution from Africa to source vaccine as a small block within a big country, in a big world, in that our numbers are greater and economies of scale would necessitate us getting possibly vaccines at a cheaper rate, but certainly CARICOM exploring that. You did indicate that approaches have been made. Can you indicate to the House where we have reached in terms of that? The numbers that continue to rise and the deaths, the unfortunate ones, are something that is of concern to us on this side, indeed all Jamaicans. And I will just close, Minister, by indicating that we here too feel quite distressed, dismayed about the constant relaxation by some of our countrymen of the social distancing measures, the masking, the physical distancing, and we will use this forum to appeal to our Jamaican citizens to continue to adhere to it. Because as you correctly say, as we all correctly say, this thing is going to take some time before it's behind us in terms of the control, in terms of reaching to that herd immunity, in terms of reaching back to a near normal. and not a new normal, but a near normal that we had before, because not only the economy, education, the tourism sector, everything depends on us reaching a particular stage before we can achieve that. And the final point, Minister, you indicated that the UK has been approached in terms of getting AstraZeneca vaccine, but recently we see where the European Union and also the UK has indicated that they will not allow vaccines to be exported until those companies can provide sufficient dosage for their countries, as have been agreed with them and the providers. In light of that, can you give us some idea as to how this particular hurdle will be circumvented?
Minister, just one question. Do you want to answer this? Okay.
Thank you, Member. Madam Speaker, through you. As I said in the presentation, the issue of more is one that we're pursuing. But I think it, as you have recognized, and maybe you should have stopped there, it is encouraging that we have started, and I think the country will be better for it. But as I had outlined, there are 5 other possibilities that we're pursuing, and some with encouraging signs. So I anticipate that we will make additional progress, and I'll keep the country informed as that happens. In terms of the infrastructure to handle the quantities that we anticipate getting in, cold storage being one, but there are others. There's the logistics chain of moving the product. There is the accommodation of the product in the respective channels, and of course the delivery of the product to the individuals, so the actual administering of the vaccine. That's a process, as we have outlined in the plan, that we've been working on. But as you correctly pointed out, we are not strangers to immunization program, and therefore that infrastructure is in place. There is a requirement for expanding the infrastructure, but the numbers that we anticipate getting during the course of this month would be more than, the infrastructure would be adequate to deal with those numbers. So we're not worried. That's the report I've had. But I did say in my presentation I'll be meeting with the working group this week to see if there are any challenges. And my view is that we have to take a very collaborative national approach. If there is a need to engage and to partner with our private sector colleagues, that is something that we should explore. And that collaboration has already started, as you would have heard over the past week. And there is a lot of experience in terms of the logistics and the management and movement of delicate products within that space also. So I think we have sufficient capacity to deal with that. The same would apply for our doctors. You asked a question around training. Some of that has been taking place, but I think given the numbers, we have the capacity. Price, you raised the issue of price, and I can't say for sure that this particular source is coming in at, you say, $455 per dose. But yes, it is true that we had anticipated at 10 or thereabouts per dosage, and have paid into the fund that involves, the last time I checked, 168 countries to distribute about 2 billion doses or thereabouts. I could be off a bit. Now, the principle of that, bearing in mind that you're dealing with a commodity that is scarce and really never existed up to recently with the emergency approvals, was to ensure that you secure your quantities. And those numbers were all based on a forecasting or a modeling of what the anticipated requirements would be. But it was also based, I believe, on ensuring that there was equity in distribution. So in a sense, some countries subsidize other countries. And I don't think we can ignore that principle, and for good reason. The truth is that the world is going to be safer when the world gets a vaccine adequately applied to the world's population. So I wouldn't spend too much time on that, or worse, interpret a slightly cheaper cost as some disadvantage for us, because the truth is there are others who may not be able to pay anything, but they would require a vaccine if we are going to have a safer world. And I think that that's the principle that we need to, that we have signed on to by going in the COVAX arrangements. Having said that, to the extent that we can get greater leverage based on what happens in the production process, I do agree that we should explore, and I'll keep the country updated on that. The issue of acceptance of the vaccine, member, is a concern. It's a concern. And it's a concern for a couple of reasons. It's a concern based on our experience of the last new vaccine that we tried to administer, or we have been administering to the country, the HPV vaccine, where the take-up rate was far less than we would have liked. I think it was in the region of probably 50% or so, when we're hoping to have probably 75%, or certainly a lot more than what was the take-up rate. It's a concern because the anti-vax movement, those persons who do not believe in vaccines and the administration of vaccines, immunization, have become a louder and more powerful voice and more resourced voice globally, and have used alternative media to really push this line about vaccines being unhealthy. The facts do not support their position, but nevertheless they are loud. Vaccines save nearly 2 million lives a year, if you go by WHO statistics. And in Jamaica, our universal approach to vaccines, our immunization, has improved our human development index as a country in terms of longevity of life and life expectancy and so on. So as a policy, both sides, we have bought into and have supported in a fulsome way vaccines, which is why the threats that the anti-vax movement represents, or the concerns that regular citizens may have, is going to have to require a response, and a response from all concerned. And that's why I spoke about the public relations approach, the endorsements, the participation by the opposition and others. We're going to have to really push hard to get the numbers well above what this indicative number represents, the 35%. So I will not say it's not a concern, but the first issue was to get the vaccine. Now that we're getting it, we will deal with the issue of take-up. On the issue of the negotiations re CARICOM and the allocation of 1.5 million, from which we will get about 250,000 doses, it was a negotiated position involving the ACP group of countries. So the Caribbean was a part of those initial discussions to negotiate a quota. And it is from that quota that the Caribbean region would have gotten this amount. And from that amount, Jamaica was allocated that amount. So we have sought to negotiate as a region to benefit from that amount. And then finally, the UK. The UK, one of our strong partners, clearly, and where we have a number of Jamaicans, strong tourism interests and so on, we have had very cordial and supportive discussions around how we respond to the threat of COVID-19, both from their end as well as ours. And there is a willingness to explore collaboration further than we have already. But ultimately, countries are going to have to take decisions to protect their populations. And I don't think that's an unreasonable expectation. The position, as I understand it, is that the UK will reserve their allocation, first and foremost, for their population. And to the extent that they have extra allocation, then they will look to friendly countries and will make appropriate supporting arrangements. I don't think it's a position much different from our position for the most part, even though we have not articulated it, but we have to protect our population. What they did say, however, in a meeting that I had with the High Commissioner and the team, including Foreign Affairs, is that they would be prepared to facilitate a conversation with the AstraZeneca UK manufacturing base, which is involved with Oxford and their their local companies and interests and support to see to what extent that connection and discussion could lead to us getting an allocation from them. So it's not entirely a hopeless case in the short term. It's a function of the discussions that will take place. Thank you, Madam Speaker.
Madam Speaker, just a follow-up, if I may. Minister, I would wish for you to be a little more definitive in this particular part of the statement, that we have also indicated our interest in obtaining information on vaccines from China and Cuba, where development of vaccines in those countries are at phase 3 of the trial stage. We await further information on those vaccines as it relates to their officially assessed level of clinical efficacy and the allocation that could become available to Jamaica. But have we, as a country, made definite approaches to Cuba outside of knowing about where they are with vaccine development to say that once reaching the phase 3 trials and they have been approved, that Jamaica is interested in getting X amount or some vaccines from Cuba?
So the answer to that definitively is yes. We have explored through direct contact and discussions from those two countries. In the case of China, the entity that represents for us the biggest possibility is an entity, Sinopharm, and a request was made by note following a meeting between myself, the Chinese ambassador, on the 13th of January. We requested an indicative timeline as to when their vaccine, which is still going through third stage clinical trials, would be ready, and it's an estimated time, obviously. They are collaborating with the World Health Organization. And remember now, the benchmark for negotiation to access is the seal of approval for emergency use by WHO. We are not intending on sourcing, up to this point, any vaccines that does not go through that expert assessment and the clinical trials that are necessary to say the vaccine is able to be administered safely. So that is taking place. And then in terms of Cuba, yes, I did meet with the ambassador, and we had a conversation. There was some requests for information. They are doing clinical trials. They are a little behind the Chinese work, and we await further advances in terms of the trials to make the decisions on that. Thank you.
Minister, as I've raised elsewhere, the role for the private sector in this rollout and administration of the vaccine is, I think there's a strong case for it. However, as I've pointed out, I think the need for some clarity and some transparency around that program, I think, will be necessary. And I'd expect that the meetings that you're having, you've indicated that you'll be having in the course of this week, that we'll have, the Parliament will be updated as to precisely how this will be rolled out and this will be implemented or administered.
So, Madam Speaker, through you, the arrangement with the private sector, we have sought to articulate on, and if there's a need for further clarity, we're happy to do that. In fact, there's an MOU that is supposed to be signed by both sides as it relates to the nature of that relationship, and my own view is that it should be made public. I did commit also through the Special Select Committee that we would invite the leaders of that initiative to attend to this parliamentary group and to address any concerns that anyone has. So between that MOU and the transparency around that and any conversation at the level of the Parliamentary Committee, I'm sure we can address any concerns you may have or others may have. Just to be very clear, though, the government is committed to a transparent approach to the distribution of the vaccine. The Prime Minister is on record to say, well, our commitment to free health care or universal access means that persons will not be charged once they access through the public space, the public system. And this supply that is coming in now is sufficient just to deal with frontline workers. And we define, those are fairly easy to be defined, starting with our doctors and nurses. And to the extent that we have additional amounts, then we will start the process of those vulnerable populations, starting with our health centers, persons with comorbidities and so on, who are the ones who are suffering most as victims from COVID. But let's be clear, as I said in the meeting, the special select, healthcare in Jamaica is a function of private and public. And I view, and we should view healthcare as a combination of offerings by the private space, offerings by the public space. And I believe that one can achieve greater efficiencies by utilizing that combined approach to reaching the full population, as long as there are clear rules of engagement to ensure that vaccine equity is preserved, that no one is deprived. That, for me, is the most fundamental principle. And I think the agreement up to this point and beyond will ensure that that is the case. Thank you.
One quick question. Minister, I thank you for your statement, and I'm happy to see that efforts are being made to expand the procurement beyond the COVAX arrangement and the 16% for this year. I wish you every success with that. I have a question for you, and it just relates to the procurement issue. In relation to the COVAX supply, your statement makes mention of communications from the manufacturers, being the Serum Institute of India and SK Bioscience. It also speaks to completing an agreement directly with AstraZeneca. And I just wanted some clarity as to who will we be contracting with? Will we be contracting with AstraZeneca or with the manufacturers, or what, when we're buying this? And I noticed that there's a mention of an indemnity and liability framework, and I would be grateful if you would give your understanding of what the basic indemnity and liability framework is for the vaccine that we buy.
Right. So in terms of the COVAX facility, we have paid into a fund that is administered by the World Health Organization, which, for simplicity of understanding, is, of course, the members of the world, countries of the world that are part of the WHO for public health, or global public health initiatives. So the discussions, the funds are held within that entity, and that entity negotiates supplies. Well, in the first instance, they use the infrastructure of the expertise that they have to monitor and to approve the drugs that are going to be administered through the facility. And because countries like Jamaica and so many others do not have that level of expertise, we're guided by that. So we depend on them to validate research. Once those approvals are had, and in this instance they are emergency approvals, then even before they are had, discussions take place about quantities and how much can be produced. And based on those targets that are set, an amount is allocated. All of that is coordinated and done by the World Health Organization, not by the respective countries. So we, in a sense, entrust them to do that on our behalf as part of the vehicle that they represent. Beyond that, however, there are agreements around. Well, before I say that, I should say that depending on where that AstraZeneca brand is being manufactured, there are two elements of approvals that are required. One is the drug itself, but the other is the process, because you have AstraZeneca South Korea, AstraZeneca India, AstraZeneca UK. The UK Oxford AstraZeneca got approval, emergency approval, some time ago, as you know. The Indian AstraZeneca combination is about to get approval or momentarily. And that's the source based on an agreement around production process that we will pull from. So it's relatively similar technology, but the production process also has to be authenticated. And WHO does all of that. However, as it relates to the indemnity, because it is emergency approval, countries, not just Jamaica, via the WHO have been asked to indemnify the manufacturer for any liability around the taking of the vaccine. And again, I say it's not a Jamaica, it's not a request for Jamaica. In other words, you wouldn't be able to get the vaccine if you did not sign on to that. And that is a position that has been relayed to us via the WHO from the actual manufacturers that have been given the green light to produce emergency sources. Part of it is the fact that it is still emergency approval, and there may be some issues around, based on the legal framework, what that represents. We have little option in terms of getting a vaccine, but at the same time, I think it's important to say to the public that we are not taking unnecessary risks as it relates to the vaccine, because the vaccines have gone through a process and we have only accepted vaccines that meet those standards. So we're really dealing with the WHO, and they are dealing with the respective locations and brands.
Thank you. Minister Shaw? Minister Shaw? May we have copies of the ministers? There is a change. It is Minister Shaw. We're waiting. Dr. Chang will come after. Have the copies of Minister Shaw's presentation been circulated? Minister Shaw, can you hold for a minute until they circulate the copies?
We have enough copies?
Ask them for one.
But when you short of paper,
Must have done one page.
There's no shortage of paper, and the minister had his copies here.
Oh, carry them up. Carry them up. No, you need to. Hello there. Follow the list right now. Madam Speaker, it has, members of the Honorable House, it has almost been a year since Jamaica had its first positive case of COVID-19. Like the rest of the world, we have been experiencing significant fallout in our economy as a result of the pandemic. This has dealt a huge blow to many of our sectors in the productive areas of the economy, our micro, small, and medium enterprises. This afternoon, Madam Speaker, I'll provide to this Honorable House a brief update on some of the initiatives that the Ministry of Industry, Investment and Commerce has undertaken to support the fight against COVID-19 and to help cushion the impact on the sector. The Ministry fully appreciates the challenges that the manufacturing sector faces even as we push to get past the lingering impact of COVID-19, the government is placing particular focus on the manufacturing sector as part of the economic recovery strategy. To this end, we have established the Manufacturing and Export Growth Team, which is co-chaired by other private sector representatives and the Minister of State in my ministry, Honorable Dr. Norman Dunn. The team, which comprises government and private sector leaders, has the key responsibility to ensure the development, monitoring, and implementation of key strategies to increase the contribution made by manufacturing and export sectors to the economy. Jamaica Promotions Corporation, JAMPRO, has also been mandated to identify areas for investment in agro-processing, cosmetics, packaging, medical cannabis, personal and protective equipment, and medical disposables and light manufacturing, among others. We fully recognize that a strong manufacturing sector creates a clear path towards economic prosperity. We have moved to implement measures to grow the sector and to strengthen its resilience. We have also sought to enhance the landscape for doing business through several initiatives, some of which were already ongoing, but which became more urgent due to the effects of the pandemic. Madam Speaker, the Ministry is also pursuing the initiatives under the National 5-Year Manufacturing Growth Strategy, which targets the achievement of $81 billion in manufacturing output by 2025, and an annual average growth rate of 3% over the 5-year period. Among the main components, improving workforce productivity, as well as increasing competitiveness and innovation. Initiatives are being pursued under the Trade Facilitation Reform Program, which will also be key in the economic recovery effort and to facilitate ease of doing business. We have seen the transformation of the Jamaica Single Window for Trade, J-SWIFT. It is a one-stop shop designed to enable traders and their representatives to transact all business engagements online through a single portal that allows access to the services of all cross-border regulatory agencies, reducing the time and ultimately the cost of doing business. Over 8,000 applications have been processed since the system was fully implemented in June of last year. Madam Speaker, on the 21st of January this year, last month, the Ministry, in partnership with the Jamaica National Agency for Accreditation, JANAC, launched a pre-accreditation approval program called PAC to increase stakeholder confidence in Jamaica's COVID-19 testing capacity, assuring sustained quality health care outcomes to strengthen the national COVID-19 prevention and containment strategy. Madam Speaker, this initiative features a joined-up government approach with the Ministry of Health and Wellness and the Ministry of Tourism to provide reliable COVID-19 testing services to meet the market needs for over 60,000 COVID-19 tests daily and reduce uncertainties associated with overseas travel. JANAC's international recognition for the accreditation of medical and testing labs will provide the assurance that the results generated by these entities can be trusted, Madam Speaker, thereby facilitating trade and protecting consumers' well-being. We are encouraging all testing labs to embrace the facilities of JANAC to become accredited through this important initiative. As Minister, I have tasked the Consumer Affairs Commission to scan the external environment to ensure that the various testing facilities are published antigen tests, PCR tests, and any other approved testing are appropriately priced so that consumers have access to affordable, essential medical diagnostic services. The Consumer Affairs Commission conducted a recent market surveillance exercise for approved private sector laboratories testing for SARS-CoV-2 in Jamaica as of January 26 last month. The details will be published in major newspapers later this week, Madam Speaker. Through the Consumer Affairs Commission, we have also taken several actions to protect our consumers. The agency has increased market surveillance and public education. They have increased market surveillance by 45% during the period of the pandemic. There has been increased surveillance and surveys of basic food items as a response to concerns about food access, availability, and pricing. The agency has also conducted 12 sanitation and hygiene product surveys of masks, hand sanitizers, gloves, disinfectant, antibacterial soaps for the period March to November of 2020. These surveys were published in major newspapers. They have conducted 2 computer surveys, re-availability and price for the period October to November of last year. The agency has also, Madam Speaker, heightened public education to report excessive pricing, hosted 2 virtual meetings with the distributive trade to ascertain adequate food supply and capacity during lockdown period. Through the Bureau of Standards, we have also strengthened our standards development and product testing arrangements to ensure that the products entering the Jamaican marketplace meet the required standards. In response to COVID, the agency has issued a call for manufacturers and distributors of infrared thermometers, as well as individuals and companies using these thermometers, to submit them for calibration and accuracy checks. Calls have also been issued to manufacturers, distributors, and importers of hand sanitizers to take in samples of the products for testing, and we urge the entities to respond to those calls. And as I'm about to wrap up, Madam Speaker, through the National Compliance and Regulatory Authority, NCRA, we have strengthened the inspection, monitoring, and enforcement activities in response to the pandemic. As of January 31, last January here, 2021, there are 68 compliant hand sanitizers currently on the market. There are 8 importers of hand sanitizers and 5 local manufacturers registered with the NCRA. Please visit the website of the NCRA at www.ncra.org.jm for the list of compliant sanitizer products on its website. Suppliers of hand sanitizers are registered when there is compliance with conformance testing against the standard and good manufacturing practices observed. Over 104,000 products were detained at ports of entry, and after inspection, Madam Speaker, testing and analysis, 54,000 were compliant. Of the 104,000 tested, 54,000 were compliant and released for sale. Over 176 samples have been assessed for compliance today. Madam Speaker and members of this Honourable House, our manufacturing, producing sector, export sectors have been among the country's long-standing contributors to economic development. These sectors have shown significant resilience despite the challenges that the pandemic has presented. The Ministry of Industry, Investment and Commerce is committed to providing all the support necessary to allow these sectors to continue to recover and to grow and increase the contribution to GDP. You know, Madam Speaker, as I close, it is said that in every crisis that we face, there is an opportunity. And the opportunity that we face now in Jamaica's economy, because the truth is, we have been hobbling along for far too long at low rates of growth. And we can use the opportunity of proper planning and to ensure that we go on a faster growth track after COVID-19. Thank you very much, Madam.
Madam Speaker, let me say to the Minister that when I saw that a statement was to be made today, having not heard for some time what was happening with respect to the role of the Ministry of Industry, Competitiveness, Industry, Commerce, and Investment and Commerce. In this period, I was really looking forward to something very substantive. The statement here, I must say, is really remarkable for the absence of a lot of detail, of any detail. It makes some general points about initiatives that are being done without saying what those are. so that we can comment on them in any effective way. So, for example, the manufacturing sector, reference was made to the MSME sector without saying, other than what we already know that has been announced in terms of measures taken to assist the sector, whether it be a credit arrangement or a care package, we have heard nothing in addition to anything that has already been said. I thought that this would be an opportunity for the ministers to say what other initiatives have been taken with respect to the MSME sector. Likewise, in the manufacturing sector, reference is made to establishing the manufacturing and export growth team that is co-chaired. And I'm not clear, Minister, what exactly is the mechanism, because it says there's a co-chair between the Minister of State and it says here other private sector representatives. I don't know exactly what that is. If you could share with us, because that's an important mechanism that we'd expect to be monitoring the growth strategy. And indeed, a document that we've long called for quite some time. I noticed that it's been laid on the table. I certainly have gotten a copy of it, which is the COVID-19 Economic Recovery Task Force, Rebuild Jamaica. I would expect I suspect that will have a lot more details in it than what we are hearing today. So I don't know if this is a companion document, but the statement by itself is really remarkable for what it has not said. So I'd like some clarity on that mechanism to say exactly what it is, how it intends to operate. Also, I'm very pleased to see that the infrastructure that is the infrastructure that are in place to ensure effective monitoring, such as the Consumer Affairs Commission, the Bureau of Standards, and the National Compliance Regulatory Authority, that they are in fact playing a critical role in the oversighting of the sector and what is taking place to ensure consumer interests are protected in that regard. With respect to the Bureau of Standards, Minister, you mentioned the thermometers that they're subjected to calibration, but the matter of standard in this period goes way beyond calibration of thermometers. Matters such as the Weights and Measures Act and what role that is playing during this period, I think it would be useful to see how those tools are being utilized during this period. And just, you made reference to the fact that some 104,000 products were detained at the port of entry. And after inspection, 54,000 of those were approved. Without assuming, and I don't want to assume, that those that were not approved of, that they were disposed of in some kind of way, and that they wouldn't find themselves in any way on the market. So, but again, Minister, I presume the budget debate is coming up. You leave quite a bit of the details for that, I suppose, but it would have been good to hear some of the details here today.
Thank you to the member. And I must say that that my good spokesman on manufacturing, among other things, he first of all has contradicted himself by saying that I had nothing to say, and then after that went on to identify important points that I had made. So I just want to point out I'm deeply appreciative of the contradiction. But let me just say, though, seriously, that, the Prime Minister had delegated the Economic Recovery Task Force, which was chaired by the Minister of Finance, and I chaired 2 subcommittees, manufacturing being one of them. And I must tell you that the report of the task force is a very hands-on, very specific, and in fact, Minister of Finance, I'm going to suggest that you table that report in the House. Oh, it was tabled. Okay, so it was tabled. Right. So you see from that task force, you see the serious drill down specific tasks that have been identified to be carried out. And that, of course, includes the manufacturing and the MSME sector, among others, as well as the export market. So I just want to say that, Madam Speaker, I just want to say that I would urge the member to take another look at that COVID task force report, because it is something that the entire country, government, opposition, working closely with the private sector, can work to get Jamaica out of the rut that we are in. Thank you very much.
Minister, while I appreciate the exhortation for collaboration involving the opposition, the reality is that the opposition was not included in the task force, which is unfortunate in my opinion, because having looked at the document, the Minister of Finance had shared a copy with me. It's a very important document in terms of what the government and the country proposes to do to move forward out of this economic malaise that we have unfortunately had to encounter. Minister, one question I have for you relates to the small business sector, MSME sector in particular, especially though that subset of it which is dependent on entertainment, tourism, people going out, people socializing, which obviously with the pandemic has been very hard hit because of the need to restrict those activities in the interest of public health. I was speaking with a lady who I know this week, and she was recounting to me her situation. She is in that business. She assists in the organization of events. She's like an event planner. And of course, that industry has been hard hit because those sorts of events are not happening. So she indicated to me that she had really financed her business through a credit card, a business credit card. And because she had no income from the business, she had been unable to make any payments, I think she said since August. At that point, the balance on her credit card was about $1.6 million. She has tried to get into another type of business, which she is doing, and that's what she's now living on, and she says she's servicing her personal credit cards from that other business, but the business credit card, she hasn't been able to service it. She has no income, and she says she's been with her bank for many years, and they know her well, and so on. The balance on that credit card is now, I think, $4 million as a result of the way in which credit card debt compounds and so on. And she says now that on a daily basis, she gets called by some debt recovery agency. Basically, I don't think she used the word harassment, but the impact of the daily calls as to when is she going to pay this down, and she's not in a position to do so, is affecting her psychologically and emotionally. And Minister, I suspect her situation is not unique. I think there are many people in the business sector that are now, they were living on savings, and the savings are depleted. And I believe that we're reaching crunch time for many businesses and many people in the country. And we haven't heard anything about any plan for trying to assist those persons, even through exhorting through the central bank and the financial sector some further leniency or accommodation. She's in discussions, with her bank to try and consolidate the debt into a loan. But she says if she even does so, she won't be able to make any payments. She'll need a moratorium for probably 6 months until things improve on the COVID front and the Minister of Health's vaccination program is rolled out. I'm just wondering whether the ministry has any plan to help business operators, especially those who have particular vulnerability to the type of restrictions that the public health crisis necessitates. Whether the ministry has, or the government has, any plan for helping those businesses survive going forward until the economy starts to show real recovery.
Well, let me just say to you that your question might be more appropriately directed at the Minister of Finance. But what I can say to you is that it is most certainly a concern that we have, right? Remember that the MSME and the small and medium businesses have always been, sort of, in some cases, already compromised. And this situation, obviously, has made things much worse. In terms of my own ministry, we are taking certain steps, such as working with the Jamaica Business Development Company, trying to channel more resources into them to reach out to more MSMEs. We have also set up small business groups in parishes across the country. We have 3 more to set up, and if the Minister of Finance approves it in the budget, we'll be able to do that. But I think that it is something, I'll give you the undertaking as leader of the opposition, that it is something that the Minister of Finance and I will need to have some further and deeper discussions on, because there's no question, and it was inevitable, that all that's happening now would have led to the kind of impact that you have described. So it's time for us to think out of the box, time for us to be creative, and everybody has to try and meet halfway to see if we can, in an orderly and effective way, come out smoothly out of this crisis. Thank you very much.
Dr. Chang?
Madam Speaker, colleagues, 2 days ago, every Jamaican citizen and friend of Jamaica witnessed firsthand the callous, brazen, irreverent, and heartless character of a violence producer in our country. The national shock and outrage that resulted from the horrendous manner in which Mistress Low Garwood was gunned down signals that even in the face of these heinous crimes, the majority of Jamaicans are still a people of compassion, of respect for expression and freedom of expression of faith, and of genuine concern for our neighbors. I wish to publicly express my heartfelt condolences to the loved ones of Mrs. Low Garwood for their loss, and in particular our church family at the Agay Christian Fellowship Church. May their faith in God give them solace in this difficult time. This barbaric shooting on Sunday, unfortunately, reflects an increasing number of homicides perpetrated by killers who are hired by family members. The availability of young men who are willing to use their guns for money on anyone, anytime, and no any place. Interestingly, of course, Madam Speaker, the 2019 report of Jamaica National Crime Victimization Survey indicates that some 70% of persons on average felt safe walking alone in their community at night, and approximately 90% felt safe in their homes. And I think 97% at this point felt safe in churches. The seeming paradox of this data provides much food for thought, Madam Speaker. We have been experiencing well over 1,000 murders for the last 20 years. It goes up and down, and we may debate the numbers, but 1,000 murders is an unacceptable and concerning number for any citizen. It runs well over 40 per 100,000. It tells us that our people feel safe in their homes and their communities. But it also confirms that the level of homicide and violence crime that have plagued our society for decades is a result of larger inter-gang conflict, with criminals killing criminals, but largely young men from our challenged communities. For years, we have earmarked a number of them, or signaled that we are aware of a number of them, but we have yet to do much to correct and transform these communities. Indeed, some members of society seem to react only when the brutality and the bloodletting is close to home. This government, however, will not allow this level of violence and mayhem to continue anywhere in our society. We will, Madam Speaker, protect all Jamaicans. We value the lives and respect the lives of every single Jamaican citizen. We will continue to invest in building police capacity and giving them the tools and resources to effectively and sustainably break the back of crime and violence in our society. But we will also continue to pursue strategic social investments within the inner city and vulnerable communities in order to provide hope to these residents and to our young men in particular. I have noted that the report from the Inter-American Development Bank ranks Jamaica as the #1 in homicide across the region. But it is noticeable that countries ranked below Jamaica, and we have been in the top 5 for a long time, have implemented special security measures on many occasions, measures that we have not adopted. In one example, Madam Speaker, for every 100 murder committed, the police kill 101 in response, and they fall below Jamaica. Certainly not a policy we will in any way seek to pursue or adopt, but it sends a signal as to what others are doing to achieve some numbers which have socio-cultural problems like us. Our society has not yet signaled a readiness for these types of extreme measures, of course, such an extensive period, such as in other issues, such as extensive periods of incarceration, because that's a fact of life in many of the Caribbean countries, who may have a similar history to ours, but not the kind of culture that is characteristic of Latin America. But they have set about to institute some very long periods of incarceration. Indeed, a review of the data suggests that even a place like the Bahamas has twice the percentage of incarceration we have, much higher than Jamaica. But Belize is the same thing, and Honduras a similar situation. In fact, we have one of the lowest rates of incarceration in the region. It's also of interest that among the inmates, Jamaica has the highest percentage who have received social support prior to going to prison. There are a number of other interesting facts. I won't go through all of them in the presentation. It is also true because I'm raising this because a lot of time we get a lot of individuals of standing who prescribe easy solutions. Why don't we do it? Why not we doing that? And this is the problem. Without examining data, because if we're going to overcome the challenge we have to begin to focus on the data and approach in a very diagnostic manner the solutions. For example, among the countries, including the Caribbean countries, we have the lowest rate of abuse of people pre-incarceration, including child abuse. That includes Bahamas, Barbados, and Belize. That's the report of the Inter-American Development Bank, a report that we should pay attention to and look at. Madam Speaker, the horror of Sunday's attack and in murders committed over the month of January have shaken our society. Notwithstanding to again look at the fact it is the horror of the events and the character of the inter-gang violence where multiple shootings took place, but it is not a major variation from the curve in the last 3 years. Indeed, they have had one, well, I'd rather give the exact numbers. In one January period, when the last high period, 2018, right after the first state of emergency, went to 143, then to 101, back up to 120, and 131. It's of course worrying, and the government is concerned, and we will in fact examine the background to the data. But the path has been fairly flat, which is our first objective. We intend to ensure that we go on a declining path rapidly. The program, in the face of these statistics, we have been more driven to pursue the plan Secure Jamaica announced by the Prime Minister from 2018, which we have been following a line of investment to execute our commitments. It's the government's comprehensive and strategic security program. Plan Secure Jamaica is the most coordinated, inclusive, and enduring security program that has ever been introduced in Jamaica. It is geared towards creating a safe, secure, and cohesive and just society, thereby setting key conditions for increased and sustained growth and prosperity. In furtherance of this goal, the efforts are centered around 10 strategic focal areas and supported by 6 strategic objectives which we have delivered on, all of which we are delivering on at this time. They include strengthening the national security architecture, which is the responsibility of this ministry, and I will briefly, I've gone through them before, I'll briefly go again because, you know, up to a week ago, one of the major writers made a comment that the commissioner must go fix 12 police stations and just let things ride in a very cynical way, when in fact this government has introduced a major reconstruction and rebuilding of our police stations, announced, articulate, and funding. It was bounded, Madam Speaker, but critically in this, it was done on the basis of an engineering survey of all 186 stations there. It wasn't done by virtue of my friends here calling on me and saying, my station bad, I must go fix it. And if you fix it, I will get some more votes in September. Nor did I reject anyone from that side calling me. Every single station was reviewed by an engineer, commissioned by the Permanent Secretary, on a contracted basis, who gave a report indicating the level of disrepair and damage. And out of that, we are rebuilding, we are demolishing 20 stations, and we are making major repairs to others to make them far more user-friendly to the communities. The other goals mentioned: strengthening the criminal justice system and other ministry, enhancing youth and community development, will come to again as we seek to bring a whole of government approach to the issue of social investment, protecting and securing our borders, maritime space and key sectors of the economy, strengthening national integrity systems, and I'd like to comment on that briefly, increasing and sustaining public support for law enforcement and public order. Of course, on the issue of corruption, it is often repeated that unless we fix corruption, crime will continue. And this government has done extraordinary in committing resources to the integrity framework. The projected cost of implementing Plan Secure Jamaica total, of course, about $1.2 billion over 7 years. And over the last Madam Speaker, our project to spend approximately $346 million up to 2023, but of course, we may have some pushback this year because of the COVID-19, which we are all going to understand, and is in an immediate, an additional priority at this point in time. This is the first government, Mr. Speaker, to put in place such a robust security plan with the necessary institutional arrangement to ensure a sustainable whole-of-government approach to social investment, social transformation, component of crime fighting. Now, I want to emphasize again, Mr. Speaker, because, Madam Speaker, social intervention, one I feel very strongly about, and maybe I'll be the first person to criticize the traditional mechanism. One major project which was identified and spoken of at length, 65% of the funding went to personnel and staff, not the people in the communities who require the funding. Projects tend to work around the community despite of issues of engaging the public. And when the projects cease, we end up with no good outcomes, and the community go back the way they were. We have to implement programs that will change and transform the services to our less fortunate in society. And this is being enhanced, Mr. Speaker. In short, to ensure this happens, we have created a security business group which involves every single ministry and relevant agency of government to ensure that we, based on socio-demographic data, will monitor and hold accountable government agencies as we execute programs in these challenged communities. At the same time, there's the Citizen Security Secretariat, which will monitor all of this on a full-time basis, and we have established a Citizen Monitoring Committee to emerge from the consensus group. And again, Madam Speaker, I pause on this because it's the first time, as confirmed by research, that we'll be entering social investment with evidence-based data. A lot of nice things going on forward, and I didn't say that. Read the research by the Capri Group, which went to an extensive work on guns and gangs in our community. A very good document to look at for those of our interest. Our strategic investments since 2016-17 has significantly improved the efficiency of the police. And so on, because I have made some comments, I have stated our investment. And while we recognize no single tool to reduce crime and violence, it is a number of events and we have activities and processes and additional legal framework. But we have been approaching all of them. Again, I hear, where's Jamaica? Jamaica is up and running. It's in Kingston, corporate area, Spanish Town, Maypen, Mandeville, Montego Bay, Negril, Horace, all our major centers, urban centers, and it's being expanded to smaller centers. We'll be a bit slower this year in this number of small townships in central Jamaica in particular, but we'll be in St. Elizabeth before half-year out. Gale, Spalding, Christiana come on next feature, right? We, Mr. Speaker, as a government, are delivering on our commitments to strengthen the security forces. Communication is no communication. At a considerable expense into the police microwave system was working, that police stations and police patrol cars could talk to each other. It was not so when we inherited the government. Renovating police on the Rock I referred to. The Jamaica cameras up. The police technology, the formation is now a year and 2 months old, involved not only in installing the relevant technology, but providing the support required that the entire police force will benefit from a new approach that can ensure effective facilities maintenance, effective fleet management, and of course, data case management. So the big book will go. It cannot be something to buy off the shelf. The software has been examined, decided, and the relevant hardware and software ordered and to be installed under our security strengthening program during the course of this year. Rapid, in the terms of institution, rapid response teams, SWAT teams, special ops teams have been set up. Border control with the MAP Brigade and JDF is fully established. And as a result, we have more gangs in courts, we have expanded our training facilities, and we now, as I said, have a series of specialized branches. I want to mention, of course, too, the QR units in the urban centers. The first major one was established in Montego Bay. As a model, we'll expand to other urban centers. The QR team in Montego Bay, after establishment, we had an average of 66 homicides downtown Montego Bay in the Days District. With the establishment of the QR team for the year, it's down to less than, it's now 12, and it's going down. And I could continue to identify the many programs being established to improve the efficiency of our police force. Mr. Speaker, Madam Speaker, there are a number of cases that need to be drawn. Just for example, we'll see that the time between committal of criminal events and apprehension is rapidly decreasing. There are a number of examples. There was a shooting on Bottom Road in Montego Bay. In 7 minutes, we had the criminals in Norwood, arrested, charged, identified and charged. Jamaica, I played a role. Murder committed in Frankfield by men from Kingston, they were apprehended on the way back at the toll booth. Same day, within hours. Jamaica, I contributed to that. We had criminals in St. Elizabeth. They're shooting someone, they were apprehended at Gutters on the way back into Kingston. Phoenix Avenue in Kingston, within minutes, demonstrating the ability and commitment of a police force, but certainly given the tools, they will effect the job. Of course, a key part of the entire process of transforming the JSF into a modern professional unit is a modern legislative framework. And I'll accept, Mr. Speaker, Madam Speaker, we have been a bit slow on that issue. But we have indicated clearly to the Crime Consensus Committee that I have engaged in extensive discussion with the Minister of Justice, who has responsibility for elements of getting legislation done, and the Attorney General Department, and reorganize our own policy team, and we are now pursuing aggressively and will ensure that a suite of legislation will be brought to the House this year, starting in this quarter, including the Firearms Act, a new Firearms Act, the amended anti-gang which we have gone through in the House, and the final regulation on the MOCA. Others will come during the course of the year. We have invested heavily, as I indicated, Mr. Speaker, and put in place a robust anti-corruption framework. In fact, as we look at the budget in the next few days, there are some who are wondering why have we put so much money with the Integrity Commission. This government is not only talking, we are committed to creating the institutions that will deal with corruption, as we are with investing in the police to give us a robust, strong, and effective law enforcement agency. Investing in institutions, Madam Speaker, is not like building a road. Designed overnight, we pave and asphalt, and sometimes we get a lot of things hidden by the tar, because if the man go and build 3 inches of compressed material rather than 6, you don't see it, the road looks smooth, and you get carpet and everybody happy. When we are building institutions that are designed to effect law enforcement, deal with anti-corruption, have high quality investigative capacity, it takes time to procure, to plan, procure, and otherwise. For example, Madam Speaker, we are now in the process of introducing the quick response team in the corporate area. Despite of the incident in the last few weeks, we're not going to rush to put the bikes on the road. The men are being trained, and they will complete their training before they are put on the road in February. We're not a reactive government, we are a prescriptive government. In fact, the expert will tell you that in business and in particular in social services, the reactive response is the least productive. And at the top of it is the prescriptive response, in between the other things. This government has chosen to do the prescriptive route, that it takes time. We get the data, we look at the data, we plan and we respond appropriately rather than reactively to give an impression out there. The signing of the National Consensus on Crime signaled our commitment to a collaborative approach to addressing crime. An agreed position among the members of the consensus, of course, I should remind this House, is to support the use of military as permitted by law in geographic areas where homicide rate is above 32 per 100,000. That is 2 times the regional average, where the level of violence supersedes the capacity of Jamaica's constable force, and the Commissioner of Police, along with the Chief of Defence Staff, agreed to its necessity. I may need to repeat that so the country can remind it's an agreement. I'm not sure if my colleagues, my friends on that side still hold to that particular commitment of ensuring that in areas where homicide exceeds 32 per 100,000, it is necessary to have extraordinary measures in place. We agreed to the special security measures needed in such instances in order to cut the homicide rate and restore a sense of calm and control in these areas. Social investment is taking place, but will take time. Security investment and special security measures allow us to create a holding position necessary to social transformation. As a people, Mr. Speaker, Madam Speaker, my apologies again. Our ire and our sense of repulsion and our collective action should be targeted at the criminals who plague our society. Not at the men and women of the Jamaica Constable Force from time to time, who daily stand in the front line of our defense. The government is making major investment through Plan Secure Jamaica to ensure that our security forces can create a safe environment in an attempt to prevent criminal violence, to respond to unexpected events such as the sudden gang shootings, and protect the rights of all Jamaican citizens. All Jamaican citizens. Our collective action as parliamentarians must be to support the efforts of the police, support the measures that give additional powers to the work of the police, to approve bold and innovative laws, policies and regulations for improved security, and make the investment necessary for national security to overcome decades of neglect. I invite my colleague parliamentarians from the opposition, they joined the government in implementing the comprehensive, coordinated, and integrative approach to fighting crime, which plan secure signals. No longer can we afford to politicize. We cannot afford to politicize crime fighting. The people of Jamaica deserve better. Indeed, Madam Speaker, I conclude on two notes. One, election is only 6 months away. In a democratic society, it is time to focus on getting the job done in government at all levels.
That's right.
Crime fighting is a matter for every single citizen in Jamaica.
That's right.
We all must unite on that basis.
That's right.
Indeed, Mr. Speaker, I say something that may cause even further disquiet. It is unfortunate, I will say it, the government, the democratically elected government cannot be vetoed in carrying out executive action in the face of a crisis.
Yes.
And should not be in a democratic society. I refer that because this is a clause in our Charter of Rights that over and over everybody will refer to. Demonstrable, justified in a free and democratic society. It is inappropriate to hold, to block executive attempt in the interest of the people if you don't agree with it. We have a responsibility, of course, to ensure that not only we respect the rights, but it also have the responsibility to ensure that others, individuals, respect the rights of all citizens. Crime, Madam Speaker, is a major problem. It has been with us for a long time. It will not be resolved by any overnight activity or single action. It needs coordinating, well-planned development of our institution to fight crime on an ongoing basis, to intervene in a structured manner in our challenged communities, provide them with the services they deserve as Jamaican citizens who are lacking adequate services, to divert our young men from a life of crime. That is the commitment of this government, Madam Speaker.
That's right. That's right.
Thank you.
That's right. Fitz, your turn. Go ahead. Mark a talk for everything. Mark a that Master Peter Phillips, you know. He talk for everything. That Master Peter Phillips, watch yourself. Fitz. Your Excellency.
Well, our batting line-up, man. Madam Speaker. Madam Speaker, thank you. Madam Speaker, the Minister of National Security concluded with remarks about the right of a democratically elected government to take such executive action as it sees necessary to deal with matters on hand in relation to national security. I think that puts the matter a bit too widely. We are a nation of laws. We do have a constitution. And the executive is expected to operate within the framework of the laws of the land, and in particular the Constitution, which binds us all and which each one of us in here swore an oath to uphold and defend. And I think it's important not to lose sight of that, because if we do, we are on the road, a slippery slope, away from a government ruled by laws to a government ruled by power uncircumscribed by laws, which is a dangerous country for us, and we don't want to go there. Madam Speaker, the Minister made a suggestion that the opposition is not supportive or has some concern about the use of the military in support of the police. To the contrary, Madam Speaker, the use of the military in support of the police is not new in Jamaica. It has been going on for decades, and it in fact provided for in law. Section 9(2) of the Defense Act says that the Prime Minister may give to the Chief of Staff, that's the Chief of Defense Staff of the JDF, such directions with respect to the operational use of the Jamaica Defense Force in Jamaica for the purpose of maintaining and securing public safety and public order. So that is contemplated by our law. And last week, when I asked for a greater presence of security forces in areas where there's a flare-up of crime, I wasn't specific to it being the police alone. We recognize the shortcomings of the police in the face of the very high levels of crime that Jamaica is plagued with, and the fact that the government has focused on building out the JDF, increasing the size of the JDF, while the strength of the Jamaica Constabulary Force has actually fallen, diminished over the last 5 years, which is a striking thought when you think the fact that the murder rate has gone up to where it is now. So, Minister, rest assured, we support the use of the JDF to complement and reinforce the police. We recognize that the police need that assistance, and we would like to see it strengthened in those areas where people are suffering from high, elevated levels of criminal violence. What we have concerns about is the use of a state of emergency as a policing tool in which persons can be detained without charge for very long periods of time. That is our concern. But using the military in support of the police does not necessitate the abrogation of the rights of the Jamaican people. And we've been saying this over and over again, and it remains true now as it was true when we first said it. So really it is time to mash down that lie. Mash it down once and for all to suggest that the Jamaican people cannot be secure without a state of emergency. You mentioned legislation in other countries, special legislation. We have special legislation here. The provision I just read in the Defense Act is special legislation that allows us to, the Prime Minister, to direct the Chief of Defense Staff, the head of the JDF, to deploy the JDF in support of public order and safety in the country. We have provisions in the Constabulary Force Act that were carried forward from the Suppression of Crimes Act when that act was repealed, providing for curfews, cordon and search, and other special security measures where the situation warrants it. And the only piece of legislation passed by this government in the last 5 years in the area of security, of any national security, is a special security measure. Or the only one I can remember, I'll stand corrected if you can remind me of any others, which is the Zones of Special Operations legislation, the ZOSO, which was much heralded at the time as a comprehensive response to the upsurge in violent crime. But it has really been a disappointment because it has not been used in a comprehensive manner. It has only been used in a few small communities where adjacent communities do not benefit from those enhanced security measures, nor do they benefit from the social investment which is supposed to go along with it. So the tools exist in the toolbox, Minister, and we on this side will support the strategic and lawful use of the tools in the toolbox to make Jamaica safe. You don't have to worry about that. But, Minister, I must tell you, I really think the government needs to act with more alacrity when it comes to violent crime suppression and management. I was on the Joint Select Committee that reviewed the anti-gang legislation. You very generously congratulated me for the role I played on that committee. That committee concluded its work before Parliament was dissolved last year. That report was finalized. More than 6 months have passed. Your statement today says The level of homicides and violent crimes that have plagued our society for decades is as a result of inter-gang conflict in which criminals are killing criminals. That being the case, we must prioritize the legislative adjustments that are necessary to improve the toolbox. We can't sit on it. We must act with alacrity and prioritize the things that will make our people safe, always operating within the rule of law and the constitutional framework that keeps us safe too. Let us not forget that. Minister, I see where in your statement you talk about more gangs before the courts. The truth of the matter is that the record of prosecuting gang offenses is woeful. We've had cases that have collapsed, people have had to be let go. We've had one trial that I'm aware of which secured a conviction for gang offenses. One trial, and in fact it was only a partial success because many of the persons before the court were set free. So don't say that the government is achieving great things in prosecuting serious crimes. It is not true. And the Minister of Justice and the entire justice system needs to focus on what will it take to enable us to use the criminal justice system effectively on the entire continuum, from investigation to arrest to prosecution to trial to conviction to incarceration and rehabilitation in incarceration. It must be a holistic, not a piecemeal response. So, Minister, I just want to reiterate so that we no longer have to go down the route of any kind of snide remarks about our motives, because I don't think they're helpful, and they're not accurate, and I don't think they take the matter any further in a positive direction. We support the efforts to make Jamaica safe. We are on the committee that was established. I think they call it CMOC, the Committee for Monitoring and Oversight of Crime, or whatever the acronym stands for. In fact, our former leader had written to the Prime Minister to request a multi-stakeholder approach to the issue of crime. We didn't receive a response for months and months and months. We kept asking for it. Eventually, it got off the ground with a summit at the Jamaica Conference Center, which ultimately spawned CMOC. And we are on it. We have 2 representatives on it, and we intend to play an active and productive role in making it as effective as possible. So, Minister, you can count on us to be supportive of any legitimate, authentic, and lawful acts to make this country safe, inside Parliament, outside Parliament. But we are not happy with how things are going now. I note what you say about the statistics for January, and that there isn't a spike. Depends how you look at it. It's true that over 4 weeks, maybe, the amount is not that different, slightly higher than last year. But the concentration of the incidents that have made up that number in January was frightening. In the last 2 weeks. And Minister, I hear you saying how effective the police are at solving these crimes. But I can tell you that many, many murders take place in Jamaica and no one is arrested. They are at large. The victims are often not criminals. They can be family of criminals. Because in Jamaica, they have a thing where they say, if you can't catch Quacker, you catch him short. And the criminals we have in Jamaica, they are so cold-hearted that they often take vengeance for whatever is motivating them if they can't get the person who they want to get, they will get somebody else who's totally innocent, but is associated, whether it be a mother, a cousin, a baby mother, a child, whatever it may be. None of us in this house, I believe, is happy with what the situation is. As you said, Minister, it's been going on for too long. It requires a national effort. But part of the role of the opposition is to hold the government accountable. So while we will cooperate, we will also be critical. We will also be strident. We will also advocate for the Jamaican people. That is our constitutional role. It's an important role. And we won't shirk it just because some commentators would rather that we kept quiet and just fit in. That is not going to happen. We are going to be constructive. We are going to be committed. We're going to be constructive. And we're going to do the job that we're here to do. So, Minister, I thank you for your statement. We called on it from last week. We wanted a statement from you because of the situation out there. I'm glad you came to Parliament today and said what you have to say. As I reiterate, we will support the legitimate efforts to make Jamaica safe. We all want that. None of us are happy with the current situation. All of us are affected by it. All of us know people who have been killed. Yes. We know them personally over the years, right through to the present. None of us are happy about it. So let us work together constructively and try and salvage the situation that we face. One Jamaica. Thank you, Minister.
Minister.
Questions of the Minister having made a statement to the House today.
Definitely, member.
I am most grateful.
Anything that is in the standing orders that is allowed, we are all allowed to do it. Go ahead.
I am very, very, very grateful, Madam Speaker.
Norm,
yes.
Go ahead.
Minister, first of all, let me add my own words of sympathies to the family of Ms. Garwood, who was murdered on the weekend. Let me also applaud the security forces and the persons who have cooperated to bring the investigations to where they are now. Minister, I have a few questions I have. You mentioned that in the statement that gangs are responsible for most of the murders, which is a fact. The data is there to support it. And you also alluded, Minister, to steps by the government to bring more gangs before the court. The leader of the opposition spoke to less than desirable success in that regard, as a matter of fact. But, Minister, the ongoing issue of persons who have been convicted, gang leaders and members who have been convicted, incarcerated, continue to run their criminal enterprises from behind bar. Minister, it cannot give the Jamaican public any source of comfort when those persons responsible for organizing and seeing to the execution of persons, that even when charged and convicted, they still continue. And you know of some cases that have been brought to your attention, which today I am not aware that any steps have been taken to prevent those gang leaders from carrying out their activities. Second question, Minister, Jamaica I. From the very outset, when your predecessor spoke in this House about it, the opposition gave full support to the Jamaica Eye program. Minister, it's over 4 years, going 5 years now, since that program was launched. I was at the launching ceremony at the National Arena. I spoke then and I gave public endorsement and support to the program. Can you indicate of the target set under the program in terms of coverage? One, if there's a target, and two, where are we in reaching that target that was set for the rollout of the Jamaica Eye initiative? Thirdly, social intervention. I was quite heartened, Minister, when you spoke about your full support for the social intervention in the country. And yes, you spoke of some intervention, social intervention, that have not given result that is desired. Can you say, Minister, which agency is responsible for the rollout of the government's national social intervention program? So that not just us in this parliament, but the general public can have a sense of what is happening, where to go, and how they can give support, put their support behind those programs. And lastly, Minister, I'm going to reiterate, again, for confidence building. You spoke about the investigative capabilities that the government has invested in and the results. Minister, yes, this morning, Sunday through Monday, 10 persons were murdered in that 24-hour period. And this is amidst all that you have said that is being done, all that you have said that the government has done, the investment, etc. You mentioned about the Prime Minister said it. I was going to ask him about it in his statement last week, but I never got the chance, about the flattening of the murder curve. Minister, I dare to say what is happening is that high levels of murders is now becoming normalized. And sadly, the Jamaican public is even becoming numb to it. For confidence building, Minister, can you say if any progress is being made in respect to that murder in Barbican some 4 years ago, where Jermaine Jr. was murdered in a house? No one has been charged to date. No sign of burglary in that house. No one has been charged, and no update been provided to the public. For confidence building, Minister, cases like these must be dealt with some alacrity, and the ordinary people feel confident that if they are murdered, and more importantly, send a message to criminals, regardless of where you are from. If you commit a crime, you'll be apprehended and you must pay. Thank you, Minister.
Minister, the opposition leader in his response spoke to the number of tools in the toolbox, some of which have not been utilized, some of which have been poorly implemented. I remember when the Zozo bill was brought to this House to be debated, much stress was laid on the strategy of clear, hold, and build as the objective of the government, the operational mantra of the government for that piece of legislation. I can tell you, Minister, and the record will clearly show that I have consistently, I've been one of those members of Parliament who have consistently supported the effort in the absence of any alternative. In the absence of any alternative, I have supported the SOE, I have supported the ZOZO throughout the island, wherever that it is, those few places where it has been implemented. But more than that, you Minister, you'll recall that you have come to this house and told us that while the ZOZO, because of the cost of the ZOZO, that it couldn't be implemented even in those areas where admittedly it needs to be implemented, but that other measures would be taken to assist in those areas to ensure that the stresses are alleviated and the social intervention takes hold. I know for a fact, and you know, that I have consistently requested, articulated a very clear set of objectives and plans and programs. And you have consistently said, yes, they will be assisted, and they have consistently been denied or not done. And in those instances, in communities that have had problems, I've seen a cessation of that violence, and over time, with the stresses and strain, have become again antagonistic, and the violence has begun to rise. And so, Minister, I believe that you have to accept and admit that even where the tools have been available, they have not been utilized, at least optimally and to the extent that the very objective for their use have been clearly established. And so I think, Minister, the challenge that is posed is not just simply that government give you fulsome and wholehearted support as executive, but that be done consistent with the plans and programs and the legislation that have been brought here and approved. And I think more needs to be done in that respect.
Thank you. Let me, maybe I should begin at the end, go back to the comments. The members' support for the policy is appreciated, but just understand a number of activities are in place we inherited. Now that they have come to an end, the policy of the government has been articulated. I'll answer the approach to social investment and take in consideration my colleague's question from South St. Catherine question. The approach that the government is adopting in this going forward is not an agency issue. While Jamaica's social investment have some specific responsibility, it's as indicated for the first time, we're looking at a holistic approach to social investment. The Citizen Security Secretariat, which reports to the Business Council and reports to the CMAC group, is designed to ensure that the efforts of the government agencies are amended and focused on the special areas that have been identified. At the top of the list, of course, the zones of special operations, where they work in concert with JSIF, but beyond that, the factors that we have identified by different researchers, issues that need to be dealt with if we're going to deal with the medium-term solution to crime. The Community Renewal Program identified 100 different areas in Jamaica, with some 20 were considered particularly challenged. All of them are associated with urban centers that requires special attention. These, in fact, are what would coincide almost with the kind of condition required in the zones of special operation. The prison survey of 2012, which I have asked to be updated now, revealed that some 20 schools had a very high recurrence rate of incarcerated individuals. These are schools that have clearly had challenges that need to be addressed. And there are other data that is out there. And therefore, we have moved with decisiveness to ensure that social investment is not a singular project by specially paid individuals, but to orient the primary government agencies that are operating in these spaces. The efforts of the government be focused on these particular areas in an objective manner. I like to use the term, members, that our approach is prescriptive and not reactive. So we have identified the committees. We need to know what we are getting in there to do. So the clear out and build policy will hold, will still be there, which is to seek to disrupt the gangsters in there. But critically, to deal with this particular question is to ensure that the Ministry of Education, the Ministry of Local Government through Social Development Commission, the Ministry of Labour and Social Security, the Ministry of Health, which provides particular preventive care, all of them are examined to see what programs they are bringing into these communities which have been neglected traditionally for many years, and to overcome what is essentially, and not in the positive, the politics of poverty. As a country, we have kind of looked at these communities, see their challenge, speak of their challenges, and we do charitable activities, which is wonderful and important, but they don't need charity, they need opportunity. And to give them opportunity, government investment must be focused here. As I indicated earlier this year when I started looking at some of these communities in detail, there's one community, in fact, where the part organizers, or those who are part, had gone in the community, identified 600 plus individuals who need to be investigated and confirmed for part. In 2 years are gone, and they have been reinvestigated. This is people at the lowest level who require assistance. And I suspect there are other constituencies which I expect have similar problem, and we'll be looking at how that is changed. But we went in, our review has been done. It was so long that the first review that at the initiation of the CSSP Secretariat for the first 300 and just over 300 individuals, 100 already died, and others have been moved by the family elsewhere, maybe gone to infirms. So we will ensure the other 120 will be on the program starting this month. And that kind of activity seems to recur because the MDAs are not geared to deal with these challenges specifically. And what you're doing is reorienting the government programs, because those parts of the standard government program designed for those at the lowest level. You have communities in which individuals are saying they cannot operate, they cannot go in. We have to ensure they operate, and part of that is where the security comes in, that they must operate in a safe environment provided by the police force, not by any negotiated peace with some criminal. This government is not involved in that. So the entire social investment activity of the government will not ignore elsewhere, but where these communities are concerned, the structure we have established is designed to focus activities on them. The gangs operating behind bars, you have raised this issue before, Minister. Much work has been done. It's not something announced, it's not a rebuilding of anything. Much work has been done to control that, and much crime has been stopped because of the intervention. But there's more work to be done. We, in fact, will have to identify and build, in addition to what we're doing within the existing station, we'll have to establish a high-security prison. It's just a simple fact of life where we can be even more rigid in controlling the activities and preventing the kind of movement out of these communities. Because the reality of it, we have to face it. While we take steps to correct the situation by both, the personnel who work in this situation, live in the same community criminals come from. At the face reality, this is a community that has become criminals out here, not only disrespectful of children, but the informed for dead culture is a long-standing part of the, unfortunately, part of our subculture. And we have to speak with that reality. So the warder who may find himself being invited to break the rules, if he doesn't find a way to do it, he may end up dead the next day. Right? So the action we are taking to protect them, to provide a system that can protect them, is ongoing. But we have to ultimately come to a point where we find a single high-security prison that we can put specially vetted individuals secure, and that we are pursuing actively. It will begin. It has started. It won't finish during the course of this financial year, I'll be honest with you, but it will be done. But that's the only way we're going to get to stop certain high-value criminals continue to find a way to subvert the system and create criminal, and continue to have criminal impact out there. Sometimes the forces involved will say to me with a little bit of a, a lot of my time is spent saving criminals. A lot of the instruction they give is not only to extort and all things, but they are out there to kill the other gang members they don't want. And we have had to spend security time to prevent the killings. And many have been stopped, but some have gone through. That's the reality of dealing with gangs like that, and we'll have to take steps. This has been going on for years. We are taking steps, I said, in all the broad areas of security, from social investment, anti-corruption, the security forces, and each area costs money. And we are pursuing that activity, but some will take a little more time. We are looking at how we can, in fact, improve the existing situation. My minister and the ministry have taken it very, very seriously. We're working closely with improving both the security of the prisons and the personnel in there. But I know there's a particular incident that you're referring to. Well aware of it. We have done some work on that particular one, and we're going to do more work. I expect by March, I'd say April, we will bring some legislation here to assist us in dealing with those with contraband going to the prisons almost willy-nilly. I think your other question, remember, I'm coming to the leader. Jamaica Eye is a project designed to be is an ongoing program. We have gone into all the townships we have at our outset. We are now moving to some smaller township in the Mid-Island here, particularly in St. Elizabeth, where the statistics will demonstrate that the armed robbery in Junction, Black River, and Santa Cruz have been particularly high. And there are a number of these smaller towns which are quite active, relatively prosperous communities where there are 2 or 3 strong supermarkets or Western Union, cash business that have all become a target for these criminals. So we are going to seek to install cameras in some of them because it will help the police and prevent and deter a lot of this activity. And the first phase begins in St. Elizabeth. The phase that we are now seeking to institute will begin to involve business persons and other members of the private sector who wish to participate in Jamaica. And that process has started, including residential communities along within the law will be done. That is dialogue now taking place between several communities in the corporate area to look at that particular activity. The program was announced and equipment ordered by my predecessor. The fact is that some aspect of it took quite a while. We had no control. The orders were given, necessary funding transferred, but in fact the primary AI equipment only came in last year, May. That's why there were cameras around, but they were not able to function at the optimum. Since then, of course, they have demonstrated their efficiency, and Jamaica is working. But Jamaica Eye is only one feature of our entire program, and it alone will not solve the problem. It cannot be the activity that we look to. It is an important addition to what we're doing. To your leader, I have heard your expression of support for programs. I think one aspect, of course, we keep kind of, and let me not talk around it. The military, to optimize the use of the military, it comes under particular legislator. They have been on the road for many years now. In fact, too long a time. That, unfortunately, and in order to maintain their standards of military, a bit different. A policeman is a policeman the day he graduates. He operates singularly on his own. Military operates in trios at least, so there's at least a senior person, a lance corporal, a corporal in place. So the numbers are limited in terms of how you can deploy them effectively. Secondly, in the current stage, they have to have a police officer with them. Right? And that is what's been the principal discussion surrounding the use of state of public emergency. The state of public emergency gives the military some additional autonomy while the joint command in the particular they're operating in. We respect especially the judgment on the length of incarceration and length of detention. Debater will go to court and see what the appeal court have to say. That's fine. But we can establish clearly that a number of things happen with the state of emergency. I said we can multiply the use of the security personnel we have. let me begin by a number of saying the police force will expand, it may be true, but the police force, we recognize, had a number of challenges when we entered as government. It's just a matter of adding boots to the ground. Get some DC, recruit some people, put them on the ground. We have expanded our training facility, and we are now in a position to begin to train 1,500 personnel per year. It takes time. We have to build, prepare, organize, and also impact on the curriculum. Not just putting men on the road for the sake of putting them on the road and tell the country we have 12,000, 14,000 people without having people who are trained effectively, and the organization of the force is also institutional organization prepared to deal with crime, criminals out there. All has been done, and we're moving out. It is during that time and until we get to the 14,000, we're looking at using the military to supplement the police. The state of public emergency is a major, is a big step. But what this government has demonstrated, a government led by Horace, is that we have been able to execute the state of public emergency without abusing people's rights. And we, leader, let us go into the history of it. A lot of the legislation that you have now that restrict the government action, you should give thanks to this government. It's the Jamaica Labour Party government that in bringing the Charter of Rights and in bringing the legislation to control the use of state of emergency that led on that. Because in another time, we must leave issue. Not bring it to get into a page, but the history is established. The use of state of public emergency abuse was established clearly by a government led by a party in 1976, and it is so this government set up and reviewed the approach to it to ensure that breach of rights would not be done. That's just a fact of history. No matter debate, right? All the activities of taking people without cause, locking up people, that was then. It is not. That has not been the conduct of this government. Right? Not true. Over thousands. Don't go there. The government of the day built wire fence and red fence to lock up hundreds of people, take them up in truckloads. When the state of emergency was concluded on the last occasion, just over 200 people were incarcerated. Don't talk about lack of thousands. People were picked up and processed as is required in the community. Hundreds of people. And all those that were detained were people who had cases against them because we were continuing to investigate. Under 300. Go back to history. You're a young man then. I too was young, but you're there. Hundreds of people take up in truckloads as Miss Grange. Right? So I don't want us to go there. What I'm saying to you, and if we don't face the reality of our history, we will not correct them. The approach of this government has been to train and organize and instruct and ensure that we do not abuse the rights of citizens. Right? Further add, you're there as a lawyer. You pay close attention to the writing of the charter. I'm sure you did. Not sure what the status then, but you paid close attention to it, I'm sure. It should be noted that we have a responsibility to that those who do not recognize the rights of individuals. Recognizing rights is not only the responsibility of government. The Charter states clearly that every Jamaican has a responsibility to respect the rights of others, and if they begin to breach it, the government has a right to protect the individual system from the abuse by others. And that's why we have, in a situation we're having where there's over 4,000 shootings, the need for extraordinary powers to control that. And indeed, Mr. Speaker, some more statistics. The accused, and according to it, it has shown it work and will work. Right? But the police, the current situation, the police work will not be belittled in all that. And that's why I highlight the issues of what the police is doing and will continue to do and apply and use the tools we have given them, the tools that this government has acquired, and provide tools with assisting and beginning to, are not working. But if we could do it at a quicker pace, it would save some more lives. Right? More is being done. But you cannot cut back the homicide rate overnight with what's happening. In addition to that, you know, you speak of police work. Police will encounter more shooting when there are 4,000 shootings out there. The police have been doing the work. They are working hard, they are working well, and they are protecting Jamaicans. Additional tools to save some lives, I think, is only interest of the country. But, Madam Speaker, I think I've made the point. For whatever support they give, I appreciate it, but they ought to think again, understand that special security measures, such as SOEs, as one of them, State of Public Emergency, is designed to save lives, protect Jamaicans, and provide the security forces with the requisite tools to carry out their mission effectively. More work is being done. The work will continue to increase and expand the size of the police force to give them the required tools. But in the meantime, I think they require all the tools they need to protect the lives and reduce the homicide rate in the country. I thank you, Madam Speaker.
It's done. Minister, on the Jamaica Eye, you indicated that it's a continuing program, yes. Is there any incentive being provided for private businesses or private individuals in the acquisition of the compatible instrument, cameras, and whatever else that goes with it to complement what the government is doing centrally?
I would say nothing specific at this point in time. I understand that the duties and things like cameras and computers and electronic materials is fairly low. I've made a special request for any changes on them for the wider community. I do find there's a very large uptake or request for the uptake. I'm not finding complaints in terms of the price of the cameras. What we are seeking to do now from the Ministerial National Security point of view is to provide the private sector individuals with specifications so that the cameras they acquire will have the required specs to be used as evidence. Now, many people are putting up cameras now, but some of them are not really at the level they should be. But we find that so far, I have not run into any hurdles in terms of cost. If it comes up, we'll discuss it. But as I said, my understanding is that the duties on them are relatively low, and you know, the Ministry of Finance have to keep the business going. And unless there's a challenge, because all the communities who are asking are not being picked up. What they want is connectivity and to be sure that the monitoring center is up and operational and that the connectivity will work. That has been the question we get from time to time.
Minister Warmington.
Minister, just Madam Speaker, just the question I posed, Minister.
This is our last
answer,
question now.
In the non-ZOZO areas, is it still your intention to address those particular interventions that have been discussed, agreed to, as you have previously?
And we have a couple of particular Parliament members. I recognize them, New Haven, section of Riverton. In the approach to the social investment program, which I thought a broader scope, the ZOZOs carry a certain level of priority. But if you look at the agreements, we have not only put in the, as I put out the document and I'm putting into a policy to come to the House with, but the current plans and the agreement we have signed off with some of our partners who continue to fund some of these operations. They set specific achievements which goes beyond the zones of special operation. In other words, to in fact get that funding into the Ministry of Finance, because we have moved to budget support, which is why we are going to include all the relevant agencies, from housing to education to health to STs to local government. And in each area there's a measurement. In fact, what I should maybe seek to do is get the Planning Institute document and put it out that is expected of the government to achieve in terms of numbers of of individuals who are trained and certified. You know, it far exceeds the number in a particular area. The parents who are families that are impacted requiring on what the response to those family needs. So specific empirical bars have been established in terms of outcomes that must be met. And therefore it spreads beyond the zones of special operations. And we have been going through a discussion. I had discussion on one zone last week. I'm having discussion with the Ministry of Education this week as we speak to look at how we'll ensure that the programs reach the particular areas. The Ministry of Education has been used one of the first shot. Local government and the STC is critical and MLSS. But part of that is that our schools is easily the best gateway to the community. To find those who are attending school, find the families behind them, find those who are not attending school as truants, and find the families involved, and begin to work with family management and community management. Thank you.
Madam Speaker, I wish to speak on the issue of our policy and effective maintenance of our roads and infrastructure. I've given the copies to the clerk when I came here.
Just a moment. The copies that were handed to Parliament by the Minister, have they been circulated? There are copies that have been handed, I know that. Please have them circulated before the Minister starts. Please.
Okay, Madam Speaker, I wish to speak on the issue.
Minister, just wait and let me have your copies circulated.
Not my fault. As soon as I came to the door, I gave it.
The copies were here long ago.
Yes. Certainly. What?
Thank you.
I don't want to
all the copies are
circulated.
Thank you. Go right ahead.
Madam Speaker, we should speak on the issue of our policy and effective maintenance of our roads and infrastructure, which will lead to the improvement in the quality and standard of works being undertaken by the National Works Agency going forward. We'll also re-examine the approach to the patching and repair of our roads. There are some 5,000 kilometers of roads under the control of central government, and we'll move to implement a proper maintenance program. Maintenance work will be viewed as either preventative maintenance or corrective maintenance, which includes performance standards, routine maintenance, periodic maintenance, rehabilitation, and emergency repairs. For performance standards, the most effective team size, equipment, methods, and procedures for performing the work will be defined for each significant maintenance work item to be utilized. Routine maintenance, which is preventive maintenance, is the day-to-day maintenance of our highways and will be carried out throughout the year, example, bushing, cleaning, side drains, and small repairs to pavement surfaces, etc. Periodic maintenance, which is also preventive maintenance, as its name implies, will be carried out periodically, usually at intervals of a number of years, and will include resurfacing of pavements, regraveling, resealing, or overlaying. It is important to note that we are dealing with very old infrastructures, and over the years, inadequate funding to satisfy the needs of not only our main roads, but also some of our secondary roads. Rehabilitative maintenance, which is corrective maintenance, will be carried out when a particular road element has reached a stage where, despite routine maintenance, it does not fulfill the function for which it was originally designed or intended. Emergency repairs will be carried out following every damage caused by floods, hurricanes, and other natural disasters. We'll have to establish the updated conditions of each road. This will be done by using Geographic Information System, GSI, and other methods of audit to audit the conditions of the roads. The last road condition survey was done in 2014. The Planning Department, through its Road Planning Unit, will urgently commence condition surveys on all the roads under central government control. This has to be done before we can put in place a realistic maintenance program and we allow for the necessary funding to be secured and prepared. We'll put in place a national road service improvement program. The first aspect of routine maintenance is roadside activities. We will begin with initial cleanup, debushing, drain, and culvert cleaning. This will cover A roads, B roads, which are secondary roads, and C roads, which are tertiaries, which total approximately 2.5 kilometers. These are normally in the worst conditions. Road maintenance must begin on day 2 on all newly rehabilitated roads, followed by regular inspection. The works of the National Works Agency must be dovetailed with that of the National Water Commission. The National Works Agency cannot complete a project, and the National Water Commission comes along shortly after to dig up the very project that is just completed. There must be planning and coordination between both agencies so that this practice is a thing of the past. The two agencies, however, have begun collaborating, and this will be strengthened. All rehabilitation should have a maintenance component beyond the defect liability period. Pavement distress accumulates as asphalt pavements age and they receive a daily pounding by traffic. If timely maintenance is not performed, distresses are compounded, cracks become potholes, and potholes become craters. We will revamp the training session for contractors on methods and procurements, methods and procedures to maintain and preserve asphalt pavements. The cost of addressing minor deficiencies is much less than addressing major deficiencies. We have to do road maintenance when roads are in fairly good condition rather than waiting until they are in very poor condition. We will embark on a program of crack sealing. A good time to do crack sealing is when the road surface is in fairly to good condition. Along with proper drainage, crack sealing is probably the single most important maintenance activity. Most pavement distress can be related to intrusion of water into the pavement structure. If water is kept out of the pavement, the majority of the distress can be stopped or delayed. Crack filling is done with liquid asphalt, cuts and asphalt emulsion, and is considered temporary work. We'll also be seeking to do more full depth and deep depth patching. The material for the patching will include hot mix asphalt, asphalt emulsion mix, stockpile patching mix, and proprietary mix with special blend of aggregate and modified blenders. Full depth patching is the removal of the entire pavement surface layer, regardless of its thickness, over the patching area, while deep patching is removing of 4 inches or more of the pavement surface. In full depth patching, the material in the repair area will be removed to the depth necessary for reaching a firm surface. This means oftentimes removing some of the subgrade. A full depth patching may even require some additional drainage. The excavation is extended at least 1 foot into the good pavement surrounding the patching area. Patches would be squared head and cut rectangular in shape without having varying lengths or width within the patch area. If the width of the patch is near the width of the lane, a full patch may be best because the contractor can use standard paving equipment rather than handwork and eliminate extraneous longitudinal joints. A pavement saw makes fast and clean cuts. After the material is removed and the patch area is cleaned, an asphaltic top coat will be applied to the vertical surface of the patch. Proper compaction is a critical factor in producing a permanent patch. Proper supervision from the NWA staff will be a critical factor in the effort to carry out proper patching. There is merit, Mr. Witter, there is merit in reintroducing for low traffic volume roads double surface dressing and spray patching to complement the patching program. We will explore a ratio of 75% of contracting these work against 25% in-house. There will be no further road construction or rehabilitation without a comprehensive drainage system. We will consider concrete for certain C roads and double surface dressing for regular C roads that are low volume roads with curb and channel, V drains and U drains. It will be necessary to discuss with quarry operators the production of the right size aggregates for double surface dressing, that is 3/8 and 5/8 inches. Hot mix being transported to site must be properly covered, even with double or triple covering, to retain the heat content and temperature. On-site test must be done on the arrival of hot mix before it is used. Job mix design is critical. Therefore, our quality control representative is mandated to visit every batching plant supplying hot mix to the National Works Agency and sample all material in stockpile frequently. The agency will conduct refresher training course tailored for its patching contractors, including traffic management. Performance standard will be set from the beginning. A contractor cannot patch more than a specified square measurement per day, and this must be monitored by the National Works Agency staff. Proper marking must be done before cutting, and deep cuts will not be left open, but will be temporarily filled with material until the day of patching. Closer supervision will be done by the National Works Agency to ensure that the quality thickness of the completed patch is in keeping with the contract. Otherwise, payment will be withheld. There will have to be proper compaction of mold base before any patching is done, and the team will ensure that the asphalt is also fully compacted. Thank you, Madam Speaker.
Madam Speaker, let me thank the Minister for his first, since being appointed Minister, for his first presentation in Parliament. But, Madam Speaker, you know, I was hoping when I saw the agenda for Parliament and saw that the Minister was going to make a statement. I was hoping that the Minister would be coming to the Parliament to tell the people of Jamaica through this medium of how it is that the agency which he has responsibility for would be easing the plight of the transporting public. Because this, Madam Speaker, the statement which we are happy about on this side, and I'm sure all Jamaicans will be happy to know that there are going to be some standards when it comes to road rehabilitation. But for him to accomplish this, it is going to take a lot of money. And until the Minister or the government itself is able to identify where these resources will be coming from, then it is going to come to naught. With all good tensions, will come to naught. You know, we have heard before, and I am happy that the Minister is re-emphasizing, the relationship between the National Works Agency and the National Water Commission. It is a fact that there is an arrangement now before this one for some time with the National Water Commission. Again, it is going to come down to the insistence and oversight of the National Works Agency for the Water Commission to not get away with what egregious works that they're doing out there and leaving them uncovered. We see contractors going out there, removing debris from potholes, filling in those potholes, but leaving the debris on the side of the road, which is a danger not only to the traveling public, but those walking on the streets also, that we want to see also be dealt with those contractors. Because it is a regular thing that is being done by our contractors. Minister, the construction and rehabilitation with including drainage, that should not, I am happy that I am seeing it in your statement, but that is something that should not be left out of road construction or rehabilitation in today's date. And I see that we are going back with a double surface, what we call chip and spray. And back in the days, double surface, we are speaking about double surface, chip and spray. Eh? Minister, you're supposed to be out of airport to signal the plane, man. Just leave road work now, no, man. Leave road work now. To welcome the leader. I am happy to hear that. Minister, back to the statement. We have used the method of the double surface road construction in the past, where we did more roads than. I'm not telling a lie upon you, so just lie me. So we have used it in the past, Minister. But the challenge that we see is the testing of the sub-base. And in many instances, where we should be getting 3 to 5 years, we end up getting less than a year before we even see potholes popping up in these roadways. It is going to be more than important that the testing and the approval of these sub-base be done properly. As we know in the past, where persons pay labs to do testing and to give results that should not be given. Favorable results. So if it is that we're going back to that as a policy, it is important that we get value for money for the taxpayers. But I would ask, Minister, this is a medium to long-term plan. What will be in place now? Is there a patching program that is going to be implemented anytime now? Because the potholes that have been left out on the road since the rains, you have patched some areas and then you go a quarter mile down the road, is pothole right across the road. And I hear some members inside here mumbling, and I know that every member of Parliament is being cussed by a constituent or constituents because of the bad conditions on the road. And I started out by saying I was hoping that the minister would have come to say to the country what will be, what will be done in the short term to alleviate some of the dangers that we are facing out on the road as it is now. So, Minister, I commend you on the statement and that you are looking forward in putting in a policy that will give us more quality than quantity. But you won't realize this unless you get the budget to do it. Because if you look at it now, with some of the roads that are now being rehabilitated, you are not even scraping the surface to go down to the sub-base because of costs. What you're doing is filling out some of the holes and resurfacing. So when you are saying going down to 3 and 4 inches, is going to be the same cost as when you're putting on the hot surface on the road. And we understand that it is the correct way to do it. But if you don't have the resources, you will not be able to accomplish this. And I'm saying that I'm happy that you have come to make a statement to the House with this in ensuring that we're getting quality and holding the agency, the National Works Agency, and the contractors to book to ensure that the Jamaican people get quality out of the road rehabilitations that we do. Thank you, Madam Speaker.
Thank you, Member. The member said he hoped that I would have come here to make a statement as to how I intend to relieve the plight of the traveling public. But I want to say that if we are to do a comprehensive rehabilitation of the roads that we do have now, and we must also appreciate the fact that we have very old structures that have not seen periodical repairs over the years. We're looking at about in the region of approximately 20 billion per year to rehabilitate our infrastructure. There's no government that we have that would be able to find that type of fund for us to do it. So we have to gradually do what we can do as we go along. The issue of what the patching, I'll ask Jamaicans to just be patient. What we're doing at the moment, we're concentrating on the main thoroughfares. We're trying to address the issue as it relates to the main thoroughfares. But I want to assure everyone that eventually we'll reach all areas that were damaged by the last flood rain. But just be patient. But we are coming. And the minister said the local government ministry is going out on a patching program very shortly. So we coordinate and we do. So I just ask Jamaica to be patient. I'm aware, the government is aware of the conditions out there, and we will address it as we go along. It can't be done immediately. But I personally will do all that I can to see that it is addressed. And this is why I state today the standard that will be followed or implemented. Because unless we have strict standard, we are going to repair today, patch today, and the road is gone tomorrow. So this is why we set the standard be followed. The issue mentioned of the contractors leaving the cut material on the sidewalk, we are aware of that, and it's unsightly. And this is the reason why we said we are going into a training session, a refresher course with the contractors to advise them as what is required. Because there's no way they should do the cutting and leave it there. It's supposed to be removed immediately. So this is part of what I'm saying here, a refresher course with all of them. As to the double surface patching, this is not going to be for the A or the B roads. This is going to be for the C roads that are lightly trafficked. And you mentioned the integrity of the base and sub-base. This is also part of what I just said. The quality control team will have to go out there to do regular inspection and test to ensure that we have what is specified and what is paid for. You mentioned that you might get tests that result that might not be accurate. This is why we're supposed to have follow-up on our team or to go out there and ensure. And the NWA staff must take on the responsibility of ensuring that there's proper supervision, proper compaction, as is stated in the contract. So a lot is resting on them, and we will be demanding full accountability from our staff in the field.
Announcements.
Laid on the table of the House today are the following: Ministry Papers number 4 to 9 of 2021, entitled Cabinet Agenda Issues, dated November 2, 9, 16, 23, and 30, 2020, and December 7, 2020, respectively. Ministry Paper number 10 of 2021, an annual report on audited financial statements of the General Legal Counsel for the year 2019-2020. Ministry Paper number 11 of 2021, an annual report on audited financial statements of the Administrator General's Department for the year 2018-2019. Ministry Paper number 12 of 2021, an annual report on audited and certified appropriation accounts of the Office of the Public Defender for the year 2015-2016. Annual report of the Water Resource Authority for the year 2018-2019. Annual report on audited financial statements of the Electoral Commission of Jamaica for the year 2019-2020. The Independent Commission of Investigation's third quarter report for the period July to September 2020, entitled Special Investigation, Ryacobury Juvenile Correctional Center, and the Independent Commission of Investigation's fourth quarterly report for the period July to September 2020, entitled 2020, the Year in Review.
Bills brought from the Senate, petitions, papers, reports from committees, notices of motions given orally.
Madam Speaker, I beg to give notice that at the next meeting of the House, I will move, be it resolved, with reference to the Select Committee appointed by this Honorable House on the 6th day of October 2020 to sit jointly with a similar committee appointed by the Senate to consider and report on a bill shortly entitled the Sexual Harassment Act 2020, that the committee be allowed to hold virtual meetings, whether wholly virtual or partly virtual and partly physical, utilizing available information and communications technologies in the manner more specifically outlined below. Preserving the rights, powers, and privileges, including voting rights, normally accorded to a member of a committee, the committee is empowered to 1, convene and hold meetings in virtual spaces created using information and communication technologies, which shall be considered committee meetings for the purposes of its mandate. 2, allow access and participation from remote locations as are enabled by means of information and virtual technologies by members and other persons authorized by the committee. 3, include members accessing and participating from remote locations as a part of its quorum. 4, receive, consider, deliberate on, and respond to feedback and submissions in formats, modes, and media, and via platforms, modes, and media enabled by means of information and communications technologies from any person. 5, consider any and all information generated, communicated, and received via formats, platforms, modes, or media as enabled by means of information and communications technologies as forming a part of the record of these committee meetings. Madam Speaker, I further beg to give notice that at a later stage, I will move for the suspension of the standing orders to enable me to take the motion. Thank you.
Madam Speaker, I beg to give notice that at the next sitting of this House, I will move, whereas the expanded program on the immunization, EPI, in Jamaica has achieved numerous milestones, with the nation having seen its last case of locally transmitted polio in 1982, measles in 1991, diphtheria in 1995, and rubella in 2000, and with over 90% coverage in 2018 of children under 12 months with the BCG, Haemophilus influenzae, type B, hepatitis B, and other vaccine. And whereas vaccine-preventable disease in children has plummeted and the WHO Vaccine Preventable Disease 2020 Global Monitoring System has indicated no reports of these infectious disease in Jamaica. And whereas the EPI does not, however, robustly address vaccine-preventable disease in adults, and whereas over the last 20 years in the USA, the role of pharmacists in immunization delivery has expanded, significantly improving the rate of vaccination among adults. And it was found in 2016 by noted researchers in that jurisdiction that the pharmacists' involvement in immunization, whether as educators, facilitators, or administrators, would likely result in the increased vaccine uptake when compared to vaccine provision by traditional providers alone. And whereas the European Interdisciplinary Council for Aging, EICA, which brought together stakeholders from the medical and pharmacy professions, the pharmaceutical industry, patient aging organization, and health authority, found that access to vaccine can be improved by enabling community pharmacists to vaccinate. And whereas pharmacists are increasingly being granted the authorization to administer vaccine in a number of countries, including Argentina, Australia, Canada, Costa Rica, Denmark, France, Ireland, Italy, New Zealand, the Philippines, Portugal, South Africa, Switzerland, and the United Kingdom. And whereas after 2 influenza seasons, an analyst of pharmacist-administered influenza vaccine in Ontario, Canada, demonstrated a net immunization increase of almost 450,000, 3% of the population, with pharmacists vaccinating approximately 765,000 people per year. And whereas pharmacists have joined the front line of the COVID-19 fight, and the intention in the USA is to expand their role in combating the pandemic and increase the numbers of providers who administer this vaccine, be it resolved that this Parliament consider allowing pharmacists in Jamaica who have attained the following qualifications: 1, a doctorate in pharmacy with emphasis on clinical expertise or training, or 2, a master's degree in pharmacy with emphasis on clinical expertise or training, or 3, an undergraduate degree in pharmacy with more than 5 years' experience as a community pharmacist, and who have undergone immunization training certified by the relevant authority in Jamaica, or B, an international immunization accreditation body to empower to administer approved vaccine in adults.
Member Hanno. Thank you, Madam Speaker. Madam Speaker, I beg to give notice that at the next meeting of the House I will move, whereas our responsibility as policymakers is to create the economic climate and mindset that will grow the Jamaican economy in a way that increases per capita income for all our citizens. And whereas we have repeated for decades that our national trade policy is export-driven, and this position was reiterated in a recent policy document, and I quote, "At the national level, Jamaica's trade policy can be said to be always export-led, even when the country introduced an import substitution policy in the 1950s, end of quote, from the Ministry of National Foreign Affairs and Foreign Trade. And whereas, notwithstanding this stated policy, over the past 10 years, we consistently imported 4 times more than we exported. And whereas our import substitution policy, which is broad-based and still being pursued today, is a dead end for several industries and has not created an export-driven economy or led to any significant export of manufactured goods despite substantial duty protection. And whereas over the past 40 years, the Jamaican economy has seen only anemic growth and per capita income has grown only marginally in real terms, while that of other countries has grown appreciably. And whereas few, if any, countries in the world have ever created true wealth for its people without developing their exports in both goods and services, be it resolved that this Honourable House debate methods of achieving a fundamental mindset shift to structurally transform Jamaica's economy into an internationally competitive, value-added export country, focusing on products and services in which we can identify a global competitive advantage. And be it resolved that we commence a process of strategic global repositioning based on a foresighting of global opportunities and a careful analysis of the goods and services in which we have or can develop a competitive advantage. And be it further resolved that Jamaica pursue strategic global repositioning not as a one-time action, but as a process of continuous innovation that fosters agility in recalibrating and improving production so as to secure and sustain a competitive advantage given rapidly changing global and technological developments. Thank you. Questions and answers to questions? Motions that may be made at the commencement of public business requiring notice. Motions relating to the sitting of the House. Motions for leave to introduce bills. Presentation of bills without leave of the House, first obtained. Public business.
Madam Speaker, I now move for the suspension of the standing orders to enable me to take the motion, notice of which I gave earlier.
The question is that the standing orders be suspended to enable the minister to take the motion, notice of which she gave earlier. Those in favor? Those against? The ayes have it.
Madam Speaker, I ask for this motion to be approved.
The question before the House is for the motion to be approved. Those in favor? Those against? The ayes have it.
Madam Speaker, with respect to the Independent Fiscal Commissions Act, I ask that the bill be read a second time.
The question is that the bill be read a second time. Those in favor? Those against? The ayes have it.
A bill entitled an act to establish an independent fiscal commission to promote sound fiscal policy and fiscal management in an effort to sustain fiscal discipline, read a second time.
The House will now resolve itself into a committee of the whole House to consider the bill clause by clause.
Chair, there's an amendment sheet that has been circulated, and I just have sort of 2 other amendments in addition to the amendment sheet. What I propose, Chair, is that we just go through clause by clause, and we can adopt the amendments from the amendment sheet as necessary, and any other amendments that may arise.
So, Minister, as soon as the amendment sheet has been circulated, we're going to put clause by clause and accept the amendments at the same time as we go through, as you so require. So we will be going clause by clause.
Thanks, Chair.
So, Minister. Right. I put clause 1 of the bill. Those in favor? Those against? Those in favor? Those against? The ayes have it. I put clause 2 of the bill.
Madam Chair, in clause 2,
yeah, go ahead.
There's no subsection 2, so the question was whether we needed a subsection 1 in front of "in this act." It could just go "2 in this act."
So we are going to put on your amendment sheet, we are going to add the amendment removing subsection 1, as there is no subsection 2. So we'll just strike 2 subsection 1.
Mm-hmm.
So let us put that amendment.
Where are you, Chair? Sorry.
That's page 2 of the bill.
Yes.
At the very top of the bill.
Mm-hmm.
Clause 2, subsection 1, in this act.
You don't need the 1.
There is no 1 required because, yes, no 2 exists. So I put the amendment removing subsection 1. Those in favor? Those against? The ayes have it. I know.
Sorry. You're not really removing subsection 1. You're just removing the
number,
the word 1.
The number 1.
Yeah. Because otherwise you take out the whole clause.
It doesn't have a subsection. So we're removing the number 1. It just becomes clause 2. Those in favor of the amendment? Those against? The ayes have it. The clause as amended will now be put to the House. We put clause 2 of the bill. Those in favor, as amended, those in favor? Those against? The ayes have it. Let me see now. Next one is clause 3. There is a part 2 requiring amendment. So part 2, establishment and function of Fiscal Commission, appointment of Fiscal Commission and staff. There is an amendment here at the top of the amendment sheet. which reads, in the heading, delete the word staff and substitute therefore the word officers. Those in favor of the amendment? Those against? The ayes have it. So part 2, as amended, is being placed before the House. Those in favor? Those against? The ayes have it. We will put clause 3, which also has a suggested amendment. I put the amendment to clause 3 before the House. Those in favor of the amendment being adopted? Those against? The ayes have it. I will now put clause 3 before the House as amended. Those in favor? Those against? The ayes have it. Clause 4. There are 2 amendments to clause 4 on the amendment sheet. Though could you? I will put both amendments, number 1 as it relates to subclause 2 and number 2 as it relates to subclause 5B before the House. Those in favor of the amendments in the amendment sheet? I cannot hear you. Thank you.
Before you put the clause that are amended, Madam Chair, there's another amendment in clause 5.
I will still put.
Can I just get this other amendment in and then you put all of clause 4?
Go ahead, Minister.
Yeah, so it's in subsection 5A, where it says the Governor General, acting after consultation with the Prime Minister and the Leader of the Opposition, shall appoint a tribunal. We would remove that as it is written and instead insert the Governor General acting on the recommendation of the Prime Minister after consultation with the Leader of the Parliamentary Opposition shall.
Minister, this is an important amendment. It's a substantive amendment. We're dealing here with the tenure of office of a fiscal commissioner who is supposed to provide some important monitoring and oversight of fiscal commitments that are in the fiscal responsibility framework and the performance of the government in achieving that. This is a provision which is dealing with removing the fiscal commissioner from office. And the bill that came here, which dealt with the appointment of the tribunal, had in it that the Governor General appoints a tribunal having consulted with the Prime Minister and the Leader of the Opposition. And that is what we normally use nowadays for sensitive positions, such as in the Integrity Commission and that sort of thing. Why would we be moving away from that to one where the Prime Minister is the person who recommends the constitution of the tribunal to remove the fiscal commissioner?
I've been advised that AG is not here, that in the Integrity Commission, this is what we use. This is an amendment being suggested by her.
No, but I don't agree with it, because the trend in relation to sensitive posts is not to give the Prime Minister the primacy of decision-making. It is to give the Governor General, who is regarded as more independent, but he must consult with both the Prime Minister and the Leader of the Opposition. Now, where you're talking about removing a fiscal commissioner, which might be a controversial issue, depending on the reasons for it, it is right that the tribunal that makes that decision should be objective and independent. And the Governor General appointing that person is the appropriate way to do it, not acting on the recommendation of the Prime Minister, having consulted with the Leader of the Opposition, which essentially gives the Prime Minister, of whichever party, the Prime Minister the determination of who is on that tribunal, but rather let the Governor General do it, because he is regarded, or she is regarded as being, as I've said, the sort of bastion of independence in these matters, but that person consults with the Prime Minister and the Leader of the Opposition.
Yeah, as you have pointed out, the bill that came here is in this form for the reasons that you had outlined. The Attorney General moments ago mentioned to me that in the Integrity Commission version of it, it has...
I don't think that is correct.
As a practical matter, it still will be the Governor General exercising his discretion.
No, it's fundamentally
I'm happy.
different.
No, look, this is not...
Yeah.
The AG is not here.
It's unfortunate she's not here. Because this is we're dealing with the appointment of a tribunal.
I am happy with it.
As is.
As it is.
Well, let's stick with it. Yeah. It is a better bill with
clause
it as
4, please.
Just to make sure I'm very clear, Minister, are you going to leave clause 5 subsection A as it was in the bill, or are you going
We're leaving it as it was. Leave it as it was.
So it's the amendment sheet that we're doing, and not the additional amendment. The two amendments on the amendment.
Consultation versus recommendation is actually no different, but...
The idea here is that the bill has a provision for the fiscal commissioner to be removed for some cause. If the Houses of Parliament, both houses, vote to remove the fiscal commissioner, and remember the government is in control of, not in control, but the government by definition would have a majority in both houses of Parliament. If it chooses to exercise that majority to remove the fiscal commissioner for cause, the next step would be that the Governor General appoints a tribunal to hear the matter. Yep. And so, given that the government at all times has the theoretical possibility of using its majority in that way, the idea is that the tribunal, you want to make sure the tribunal is seen to be impartial. And therefore, the way it's written, as the bill came to the House, is that the Governor General acting after consultation with the Prime Minister and the opposition, if the Prime Minister is seen to be influencing the composition of the tribunal, then you don't have the check and balance that you want to have, that the houses come together and it's almost like houses come together and say, look, this person needs to go, and the Governor General appoints a court, essentially, that will try the case. But his appointment needs to be seen as impartial. I was just, I defer to the legal, if they said it's an integrity commission, it's done in a particular way. But my layman's
consultation, recommendation can be interchanged.
They're fundamentally different, Acting Speaker. They're formulations
Minister,
that exist.
You're withdrawing that amendment, and we will just go with the two previous amendments.
Leave it as it is,
which is subclause 2 and as it relates to subclause 5B. Members of the House, I put to you the two amendments under clause 4, subclause 2 and subclause 5B. Those in favor? Aye. Those against? The ayes have it. I now put to you the amended clause 4. Those in favor? Those against? The ayes have it. Minister, I am not seeing any amendments for clause 5, 6,
Madam
7.
Speaker, are you piloting the bill or is the Minister?
No, I'm not seeing any amendments for clauses 5 through 9.
There aren't any.
No. So you can put 5 to 9 together.
So I'd like to find out if it's okay for us to put clause 5 through 9. I didn't know the leader of the opposition was piloting the bill. 5
to the 9. Can we put 5 to 9, Chair?
Yes, Minister. So the question before the House is we would like to put clause 5 through 9 to the House without any amendments. Those in favor? Those against? The ayes have it. We would now like to put clause 10, which has a series of amendments. Please spend the time to go through. So the clause 10 has amendment 1, amendment 2 for subclause 1, amendment 3, subclause 2, amendment 4 as it relates to subclause 3, let me put these 4 amendments first. 3, Commission. As it relates to, we'll take clause 3 separate, Minister. So let me do these first. 1 through 4, those first 4 amendments, put before the House. Amendments 1 through 4. Those in favor? Those against? Number 3. Oh, sorry. I would like to, no. Not yet. No. Thanks. I put to the House clause 10 as amended with 4 amendments. Those in favor? Those against? The ayes have it. Clause 11. 1 amendment. I put the amendment before the House. Those in favor? Those against? The ayes have it. So clause 11, is being put to the House as amended. Those in favor? Those against? The ayes have it. Clause 12 has an amendment. Clause 12, subsection 1. I put the amendment to the House. That's only seeing one. You have another one? Only 12, subsection 1. So clause 12, subsection 1. Those in favor of the amendment? Those against? The ayes have it. So we put clause 12 before the House as amended. Those in favor? Those against? The ayes have it. Clause 13. In subclause 7, there's an amendment. I put the amendment to the House. Those in favor? Those against? The ayes have it. We now put clause 13 as amended to the House. Those in favor? Those against? The ayes have it. Clause 14, subclause 1, also has an amendment. We put the amendment to the House. Those in favor? Those against? The ayes have it. Clause 14, as amended, is now being placed before the House. Those in favor? Those against? The ayes have it. Clause 15. There are 2 amendments, subclause 3 and subclause 4. I put both amendments to the House. Those in favor? Those against? The ayes have it. Clause 15 is put to the House as amended. Those in favor? Those against? The ayes have it. Clause 16. I'm seeing no amendments here, Minister. Are there any amendments? So we put clause 16 as is to the House. Those in favor? Those against? The ayes have it. Clause 17.
Clause 17, Chair. Want to scratch amendment 1 in the amendment sheet, keep amendment 2, and in place of amendment 1, clause 17, subsection 1, the proposed amendment is the proposed amendment is the Governor General shall by instrument in writing on the advice of the Minister after consultation with the person designated by the Leader of the Parliamentary Opposition to be the spokesperson on finance, appoint an advisory committee, capital A, capital C, to be called the Fiscal Advisory Committee, capital FAC.
Just on that issue, though, the formulation Leader of the Parliamentary Opposition is not correct. It's the Leader of the Opposition. It's a constitutional position.
Fair enough.
So let us just stick with Leader of the Opposition. But apart from that, it's a little unusual in the sense that I don't think I've ever seen legislation which recognizes spokespersons in the opposition setup. They have really no legal status. It's a construct of the oppositions,
It is, which is why this is why we had the problems with this clause, and that's why we have to amend it.
I mean, what you were proposing before was the norm. In other words, the amendment you have on the sheet, which deleted the other option, would have achieved the normal arrangement.
But then we get an imbalance in the minister and the leader opposition.
Right.
So just settled on, we're going to have something unusual. It's better to have the unusual
I don't have
thing.
a problem with, but let's refer to the leader.
The leader of the opposition. Yeah. So we would, for one, we would delete the existing clause 17, subsection 1, and substitute as follows: the Governor General shall, by instrument in writing, on the advice of the minister, after consultation with the person designated by the leader of the opposition to be the spokesperson on finance, appoint an advisory committee, capital A, capital C, to be called the Fiscal Advisory Committee, capital F, capital A, capital C. And then clause 2 would be amended as in the amendment sheet.
So, House, the new amendment 1 for clause 17 is being placed before the House. Previous documented amendment on the sheet has not been considered by the House and is therefore not being placed. In addition, the second amendment, as it is recognized here on the amendment sheet, is also being placed before the House. Those in favor of the new amendment 1 and amendment 2 as per the sheet presented may say aye. Those opposed? The ayes have it. I now put clause 17 as amended by the 2 accepted amendments before the House. Those in favor? Those against? The ayes have it.
18 and 19 you can put together, Chair.
I put before the House clause 18 and clause 19 of the bill. Those in favor? Those against? Those against? The ayes have it. As it relates to the first schedule, there is one amendment to the first schedule: insert pension and other benefits of Fiscal Commissioner. Those in favor of the amendment? Aye. Those opposed? The ayes have it. In respect of the second schedule, in the heading, delete the word staff and substitute therefore the word officers is the requisite amendment. Those in favor of the amendment? Aye. Those against? The ayes have it. So we will put the amendment as accepted and the first and second schedule as amended by those or as adjusted by the accepted amendments before the House. So those in favor of the adjustments to the first and second schedule may say aye. Those opposed? The ayes have it. Finally, the third schedule, there are no amendments here. Those in favor? Those against? I hope I'm counting properly. We have a total I put the title of the bill, an act to establish an independent fiscal commission to promote sound fiscal policy and fiscal management in an effort to sustain fiscal discipline before the House. And the enacting clauses. Those in favor, and the enacting clause. Those in favor? Those against? The ayes have it. The question is, I do report the bill as having passed the committee stage with 19 amendments. Those in favor?
Madam Speaker, I ask that the bill be read a third time.
We passed that section. No, anyway. All right. Let's go back, please. So.
A bill entitled An Act to Establish an Independent Fiscal Commission to Promote Sound Fiscal Policy and Fiscal Management in an Effort to Sustain Fiscal Discipline, read a third time and passed.
House Leader.
Madam Speaker, I think you haven't reported that the bill is passed. Then the Minister will ask for the third reading of the bill. He did? He did? When?
We have indeed had the third reading of the bill, and the bill has been passed by the committee and signed, having been passed with 19 amendments. Thank you, House.
Madam Speaker, I now ask that the bill be read a third time, for the second time.
Madam Speaker, it is not intended to do any further business for the day. I therefore invite you to adjourn this House until Tuesday, the 9th of February, which will be the last sitting of this session. And we will take a break and then return on the 18th, Thursday the 18th, for the ceremonial opening of the new session of Parliament. May it please you, Madam Speaker.
The House will now adjourn to be reconvened on the 9th of February at 2 p.m. Those in favor? Aye. Those against, the ayes have it.
hoping to join us. I want to say a special welcome to our presenters for this, the first of our 4 symposia during Reggae Month, and our audience across the world joining us virtually on various platforms, as you would have indicated before. Our technical team who have worked so hard, I look around and I see the wonderful work that they have done and are doing. And ladies and gentlemen, generally, boys and girls, I must say hello as well to the makeup artists who allowed me to have on a good face for this evening. Good evening to you all, and thank you for joining us this evening. It is my pleasure to welcome you to this, our first in the series of 4 symposiums